I want to look at this hot mess. Oh god. What the fuck? Because I feel like it's a funny meme. Because I've only watched part of it. Yeah. And then I don't know what video game I want to play. I might play some Call of Duty probably. Probably. Yeah. While watching this, we'll just play City Skylines.
What do you think? Let me ask you, what do you think is the single biggest problem with the current healthcare system in the United States? How do you think it should be fixed? We've talked about this a whole lot. And do you buy the bill of goods that the official Bernie Sanders campaign is selling? I know we have a lot of former Bernie supporters. Where do you line up? Single-payer healthcare, universal healthcare? Do you know the difference? Which one do you prefer? Okay, let's go to this video for some context as to what we'll be talking about. The campaign of Bernie Sanders, they released this video finally explaining how they will pay, or he will pay, for Medicare for lots of problems, but Medicare for all. Here's their explanation.
The truth is, we are already paying for our broken healthcare system.
Why are you so shocked by this?
Right now, we spend over $3 trillion a year on a crappy, broken system.
Crappy?
We pay about twice as much per person.
Okay, it always makes me laugh every time I watch a Steven Crowder video because his background quartet of people, their little stupid quips are always just the funniest thing. To crappy, poopy, stinky. Like they always cut people off, or like it's impossible to hear the video sometimes because they're just saying some dumb shit in the background.
And as our friends in Japan and Germany. And for what? To have over 30 million people uninsured and over 40 million.
See, like, to have better healthcare. Okay. But if nobody can afford it.
Can't afford the insurance they have.
I think I want my money back.
Yeah, probably shouldn't have gone with a casino clip, but also we pay for better healthcare. That's the most important question. That's the question that I think is most imperative here. So this is something that's important. The premise is,
Yeah, but if half your population can't afford it, it was like 40 million people. That's not close to half, but or is that 300 million? Was it 325 million? 40. What was that, like 12%? Anyways, regardless, you have all those people. Wow, none of my offices are being okay. Good meme. None of those people. Oh yeah, because I raised the taxes on everything. True. To get. Thing. All right. Yeah, if nobody can afford it, like you would consider your system immoral. So even though you have the best, well, it's just healthcare for the rich, right? Like if we go to the very extreme, right? You might have the top tier, best possible healthcare ever. But if only the richest people, like if only 10% of the population can afford it, that's not really immoral. That's not really moral. So we could backtrack that all the way. It's like, okay, well, where is the moral line? So is it moral for 50% of the country, 51% of the country to be able to afford it? No, not really. And then it depends on like where the split is as well, right? So, okay, so let's say I think it's 12% basically, right? So if only 12% of the population can afford it, is that moral? Say maybe, but where is that 12% line? Where does that 12% of people line up? Oh, the poorest people. Okay. So what is wrong with the poorest people? Well, Republicans would say, well, they just don't work hard enough. And they chose the wrong job. They've caused their own problems, so fuck them. It's like, okay. If that's your belief system, then I understand why you would... Oh my god, I'm burping. I apologize. I understand why you would come to the conclusion that that single payer doesn't work because you're giving free shit to people who don't deserve it. But in reality, we know that poor people are in their situation because of other means. Be it the education system is bad. Be it wealth inequality. Be it inadequate wages. Be it inaccurate public services. Be it any number of things. The housing market being fucked. Anything that makes people poor, or anything that's regressive, I guess, could lead to people not being able to, or people being poor, having a poor economy, having blah blah blah, all these things. Not just, you made bad choices. So we know that all those things play into each other. So how do we want to help these people? It's pretty much the like what in what way can we best help everybody to an equal amount? Not just helping people who have money the most, and not just and leaving people who don't have money to die or just to not be healthy. How can we help as many people as possible, as best as possible? Is the balance we're trying to get into. And that's why most countries have gone with single payer, because it helps the most amount of people possible in the best possible ways. So yes, that might be weaker than a paid healthcare system or a privatized healthcare system, but the cost of a private healthcare system makes it so that a bunch of people can't afford the service, so they just go without healthcare. So there's a large population of people who just don't have healthcare at all, which in my mind is pretty immoral.
People are uninsured. Repeated studies have shown us that sometimes, by the way, an increase in total number of uninsured people, it actually just has to do with people who make above average income opting to go uninsured, while the actual number of uninsured poor people goes up. Sorry, of insured poor people goes up. This is me. I just had a stroke.
So that study could be fudged because of a number of factors, right? Usually if you're wealthier, you're living in a more safe environment, healthier environment, so you might think that you don't need insurance. And maybe that's not true. And then maybe what could be true for the opposite end is that poor people live in typically worse neighborhoods, unhealthier places, eat unhealthy food, and require health care. They're more often sick, whatever, so they believe, and they're less educated on stuff, so they believe that they need the health insurance, so they go and pay for the health insurance, and they get fucked because it turns out it's way too expensive. So because typically people who are wealthier are more educated on stuff, so they understand that buying health insurance is a fucking scam, so they don't buy it. But poor people believe they need it, and most of the time they do need it, so they pay for it, and if they never get sick, then they're just throwing money away, and yeah.
People who can afford it
need some of that healthcare.
Forego insurance. Yeah. People who are poor, actually, more of them are signing up. So the numbers are a little bit.
So that, but the question is then why does insurance exist? Why does health insurance exist if people who have money to afford it don't buy it? Right? Why do payday loans exist if not to prey on poor people who don't have the money? If you have the money, you don't need a payday loan because you know that it's a fucking scam. If you have the money to afford healthcare, you don't need insurance because you know that this insurance is a scam. So poor people seem to, or can't really take the risk on insurance being a scam because they could get sick tomorrow and be completely fucked, or maybe they won't get fucked by their insurance.
More complicated than they make it seem, and that's just the most commonly cited number, by the way. I was one of them. I was one of those people when I was in my early 20s. It was stupid. Don't roll the dice like I did, but instead I decided to save more money. I didn't pay for healthcare, and then I got the AIDS. All right, next clip. Let's see how they explain. This is their big justification, is that it will actually cost less. That's the crux of it.
What's strange about this, though, is that he's advocating for people not to pay for health insurance and stuff like that, blah, 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 all this stuff. So basically boycotting health insurance, even if you don't need it. But then the profits of those health insurance companies would tank, and the drug companies would tank, probably, I think. I'm not sure how much drug companies make off of insured people, but their profits would tank, and then you wouldn't have all these insurance companies, and then all of a sudden your healthcare system's fucked because all these insurance companies don't exist anymore. But I'm pretty sure what he would be advocating for is like, oh, boycott them so that they lower the prices, and they lower the prices, and then everyone signs on. That's, I guess, what he's advocating for. Like, oh, boycott for, even though he's usually against most boycotts, but any left-wing boycotts, he's like, oh, fuck him. But it's okay. We'll assume that that's what he's going for. Just be a little sharper.
We're already projected to spend more than $50 trillion over the next 10 years for a system only a big pharma executive could love. A lot of that money comes from the government, but the rest, it comes from you. This would change for the better by moving to a Medicare for all system that will actually save you and everyone else in America a whole lot of money.
Help me, I'm poor.
Don't take that from me. Take it from a conservative study backed by the Koch brothers.
Who are you, LeVar Burton? You don't have to take my word for it. Here's a 6-year-old who's barely literate. It's in a book. Just take a look. Like, what? I'm watching your show, LeVar.
I know, right?
Way to offload it onto the migrant working class. So, as far as the claim here, by the way, there's a Koch-funded study that proved that this plan would reduce costs, which of course I don't agree with, but they say over 10 years. Washington Post fact-checked it like 2 years ago, gave it 3 Pinocchios. That's one more than 2.
Yep.
I just wanted to show that I know how to do some math.
There you go. It's important.
Actually, 4 out of the 5 studies conducted have shown that there is a cost increase for Sanders' plan. Also important to note, the author of that study himself said that it did not show Bernie Sanders' plan would reduce costs, and he kindly requested that Bernie...
God, my fucking fingers are not in the right spot for typing. My keyboard's angled and my fucking coffee's in the way. New York Times. Okay. Bye. Okay. Current law. Markadis. Friedman. What the fuck? When Medicare for all save billions or cost billions? So current law. Spend $800 billion on Medicare, other health spending, private health insurance. But this doesn't give me a total. Under current law, again, government estimates of the U.S. will spend more than 1/6 of the GDP on healthcare this year, with those costs divided between the federal government, individual employer, and state government. Read for this one. Freeman study. Mercatus. Randcorp. Corp. Urban study. Okay. How much would a Medicare for all plan like the kind endorsed by Democratic presidential candidate Bernie Sanders and Elizabeth Warren and change health spending in the United States? Some advocates have said that. When is this posted, actually? 2019. When is this made? Does it say? It might say at the bottom. Okay, October 16th. Let's demonstrate healthcare spending in the United States. Some advocates have said costs would actually be lower because of gains in efficiency and scale, while critics have predicted huge increases. We asked a handful of economists and think tanks with a range of perspectives to estimate the total American healthcare expenditure in 2019 under such a plan. The chart at the top of this page shows the estimates, both in composition and in total costs. In all of these estimates, patients and private insurers would spend far less and the federal government would pay far more, but the overall changes are also important. They're larger than they may look. Even the difference between most expensive estimates and the second most expensive estimates was larger than the budget of most federal agencies. So, estimate costs under current law. Estimated U.S. health cost expenditures under Medicare for all in 2019 is shares of GDP. Urban Institute, Thorpe, and... So, wait, what? So, estimates of U.S. healthcare expenditure under Medicare for all in 2019 as a share of the GDP. Estimated costs under current law. Oh, is that what that line is? And then this is more? 20% of GDP. Other 2019 budget estimates as share of GDP. I don't get it. The gray that. And this must be the gray under current. Anyways. The big difference in estimates of experts reflects the challenge of forecasting a change of this magnitude. It would be the largest domestic policy change in a generation. The proposals themselves are vague on crucial points. More broadly, any Medicare for all system would be influenced by the decisions and actions of parties concerned, patients, healthcare providers, and political actors in complex, hard to predict ways. But seeing the range of responses and the things that all the experts agree on can give us some ideas about what Medicare for all could mean for the country's budget and economy. The estimates come from Gerald Freeman, a professor of economics at the University of Massachusetts Amherst, whose estimates were frequently cited by the Bernie Sanders presidential campaign in 2016. Charles Blahouse, a senior research strategist at the Mercatus Center at the George Mason University and a former trustee of Medicare and Social Security. Analysts at the RAND Corporation, a global policy research group that has estimated the effects of several single-payer healthcare proposals. Kenneth E. Thorpe, the chairman of the Health Policy Department at Emory University, who helped Vermont estimate the cost of a single-payer proposal there in 2006. Analysis the Urban Institute, a Washington policy research group that frequently estimated the effects of health policy changes. Right now, individuals and employers pay insurance premiums. People pay cash co-pays for drugs, and state governments pay a share of Medicaid costs. In a system like one introduced as a bill by Mr. Sanders, or another from Representative Pramila Jayapal and the Congressional Progressive Caucus, nearly all of them that would be replaced by federal spending. That's why some experts describe such a system as single-payer. Other Democrats who are supporting average expansion through Medicare have offered more modest proposals that would preserve some out-of-pocket spending and a role for private insurance. The economists made their calculations using different assumptions and methods, and you can read more about those methods at the bottom of this article. These two estimates, for example, from the Mercatus Center and the Urban Institute, differ by about $730 billion per year, roughly 3% of GDP, and two groups that don't often agree on public policy. Mercatus tends to be more right-leaning and Urban more left-wing. Estimates, So Urban Institute actually has more going towards... No. What the hell is this border? Is it a more then? Maybe. The biggest difference between the Mercatus estimate and the Urban one is related to how much the new system would pay doctors, hospitals, and other medical providers for health services. Mr. Freeman estimates the least expensive of the group assumed that the government would achieve the largest cost savings on both prescription drugs and administrative spending. How much would doctors and hospitals providers be paid? Pay too little and you risk hospitals closing on unhappy healthcare providers. Pay too much and the system will become far more expensive. Small differences add up. Estimated increase in Medicare payment rates paid to medical providers. Freeman, blah, blah, blah. Man, blouse. In our current system, doctors and hospitals and other healthcare providers are paid by number of insurers, and those insurers all pay them slightly different prices. In general, private insurers pays medical providers more than Medicare does. Under a Medicare for all system, Medicare would pick up all the bills. Paying for some of the prices that Medicare would pays would mean the different. Should I just go under? I'm reading a lot of. Fuck it. Paying the same price that Medicare pays now would mean an effective pay cut for Medicare providers who currently see a lot of patients with private insurance. For Medicare for all system to save money, it needs to reduce the healthcare industry income somewhat. But if rates are too low, hospitals already face financial difficulties and could be put out of business. My camera fucked now. Nice, mint. Where was I? Their rates are too low. Okay. Neither Mr. Sanders' legislature nor the Jayapal House bill specify what a Medicare for all system would pay, but they say that Medicare would establish budgets and payment rates. So our estimates offered their best guess of what they thought such a plan might do. Mr. Thorpe said he picked a number higher than current Medicare prices for hospitals because he thought anything lower would be unsustainable. Mr. Blahouse said he constructed his starting estimate at precisely Medicare rates, though he thought the real number would most likely be higher. He also reran his calculations with a more generous assumption at 111% of Medicare, around the average amount all health insurers pay medical providers now. The total shot up by hundreds of billions of dollars, around about an additional 1.5% of GDP. How much lower would prescriptions cost be? By negotiating directly on behalf of all Americans instead of having individual insurance companies and plans bargain separately, the government should be able to pay lower drug prices. Estimated reduction in drug spending: Friedman 31, Blahouse, Thorpe, Urban, Rand 11. So Friedman 31%, Blahouse 12%, Thorpe 4%, Urban 20%, Rand 11%. What was the other one? Estimated increase in Medicare payment rates. Oh, okay, payment rates. Patients in the United States pay the highest price in the world for prescription drugs. That's partly a result of a fractured system in which different payers negotiate separately for drug benefits, but it also reflects national preferences. An effective negotiator needs to be able to say no, and American patients tend to want access to the widest array of cutting-edge drugs, even if it means paying more. A Medicare for All system would have more leverage with the drug industry because it could bargain for the whole country's drug supply at once, but politics would still be a constraint. A system willing to pay for fewer drugs could probably get bigger discounts than one that wanted to preserve the current set of choices. That would mean, though, that some patients would be denied the medications they want. All of our economists thought a Medicare for All system could negotiate lower prices than the current ones, but they differed in their assessment of how cutthroat a negotiator Medicare would be. Mr. Freeman thought Medicare for All would reduce drug spending by nearly a third, and the Urban team said that the savings would be at least 20%. The other research imagined more modest reductions. How much more would people use the healthcare system? By expanding coverage to the uninsured, adding new benefits, and wiping out cost sharing, Medicare for All would encourage more Americans to seek healthcare services. 7, 11, 15, Urban's, I guess, didn't give a number, Rand 8%. Medicare for All would give insurance to around 28 million Americans who don't have it now. And evidence shows that people use more health services when they're insured. That change alone would increase the bill for the program. Other changes to the Medicare for All would also tend to increase healthcare spending. Some proposals would eliminate nearly all co-payments and deductibles. Evidence shows that people tend to go to the doctor more when there's no such cost sharing. The proposal plans would also add medical benefits not typically covered by health insurance, such as dental care, hearing aids, and optometry services, which would increase their use. The economists differ somewhat in how much they think people would increase their usual Medicare services because of the way the Urban Institute team's estimate was calculated. It wouldn't easily provide a number for this question. What would Medicare for All cost to run? Right now, the healthcare system is complicated with lots of different payers and ways to negotiate prices and bills for service. A single payment system could save some money by simplifying all that. Estimated administrative costs as a share of the spending: 2%. Blahouse didn't give anything. Thorpe 6%. Urban 6%. Rand 5%. The complexity of American system means that administrative costs can often be high. Oh. My city burning. I am actually losing $100,000 per second. Amazing. That's also because my jobs don't exist. So I'm just gonna make these taxes 0. Actually, it doesn't help. I'm pretty sure that doesn't help. Make it 10%. We literally just have to wait until they get back to start working. That's all I have to do. Is that just wait until people start working again in the fucking city. Public shareholders' return. One key possible advantage for Medicare for all system would be to strip away some of those overhead costs, but estimating possible savings in management and administrative is not easy. Medicare currently has a much lower administrative cost share than other forms of insurance, but it also covers sicker people, distorting such comparisons. Certain administrative functions, like fraud detection, can have a substantial return on investment. The economists all said administrative costs would be lower under Medicare for all, but they differ on how much. Those differences amount to the percentage points on top of the different administration of medical spending. On this question, they weren't that much different. Well, Freeman said 2%, everyone else said 6 and 5. And 1%. And the estimate said all costs would be lower under Medicare for all. Those differences amount to percentage points on the different. On this question, they were roughly agreed among our estimators that administrative costs would be no higher than 6% of medical costs, a number similar to the administrative costs that large employers spend on their health plans. Mr. Blauhaus said a 6% estimate would probably apply to populations currently covered under private insurance, but did not calculate an overall rate. But what will cost me? What will it cost me? All of these estimates looked at the potential healthcare bill under a Sanders-style Medicare for all plan. In some estimates, the country would not pay more for healthcare, but there would still be a drastic shift in who is doing the paying. Individuals and their employers now pay nearly half of the total cost of Medicare, but that percentage would fall close to zero, and the percentage paid by the federal government would rise to compensate. Even under Mr. Blauhaus' lower estimate, which assumes a reduction in overall healthcare spending, federal spending on healthcare would still increase by 10% of the GDP, or more than triple what the government spends on the military. How that transfer takes place is one of the least well-explained parts of the reform proposal. Taxation is the most obvious way to collect that extra revenue, but so far none of the current Medicare for all proposals have included a detailed tax plan, even if total medical spending stayed flat overall. Some taxpayers could come out ahead and pay less, others could find themselves paying more. Raising revenue would require broad tax increases that are likely to be partly borne by the middle class, potentially impeding passage. Advocates, including Mr. Sanders, tend to favor funding the program with payroll taxes. For some people, any increase in federal taxes might be more than offset the reduction. For some people, any increase in federal taxes might be more than offset. By reduction in their spending on premiums, copays, deductibles, and state taxes. There is evidence to suggest that premium savings by employers would also be returned to workers in the form of higher salaries. Sure. We'll give them the trickle-down argument right now. But depending on the details, other groups could end up paying more in tax increases than they save in those reductions. After Mr. Sanders' presidential campaign released a tax proposal in 2016, the Urban Institute tried to calculate the effects on different groups, but it found that the proposed taxes would pay for only about half of the increase of the federal bill. That means that a real financing proposal would probably need to raise a lot more in taxes. How those are spread across the population would change. Who would be better or worse off under Medicare for all? Okay, this doesn't really answer anything, but that's okay. So we get a good question of like, well, no one really knows.
Stop saying that it would. He's like, yeah, my study, it didn't say that, so just kindly stop saying it said that. By the way.
But regardless, all of these economists and stuff like that are saying that it could be higher, it could be lower. Administrative costs could be lower. Estimated reduction of drug spending, drug costs would be lower, and whatnot. But it could cost more overall.
Hit the notification bell. If you're subscribed, that doesn't mean a whole lot. Hit all notifications, and do consider subscribing to Crowder Bits, another YouTube channel that hasn't been banned by the overlords yet. So they do get my lawyer. Shh, don't say it. Yeah, we're flying under the radar here by broadcasting it merely to everyone. Then they go on to explain this system in depth. Let's roll it, and I want to freeze it for a second. Okay.
Let me explain how.
Okay, pause. All right, tax the wealthy. We already do.
Right.
They pay.
Okay. This argument makes me fucking injure myself. Tax the wealthy. We already do. We don't need to tax the wealthy anymore. We already tax them 30%.
a disproportionate amount of taxes, eliminate
more.
paperwork. Oh, really? Is that so? You'll be effective at eliminating paperwork. Federal government. And then reduce...
Nice one. Nice rebuttal. Nice rebuttal. First rebuttal was, we already tax the rich. Okay, but we don't tax them enough, clearly. Eliminate paperwork. Federal government bad. What's his other rebuttal?
Reduce drug costs. Well, they don't really explain how they're going to reduce drug costs, just that they'll tell people, I would like you to stop paying so much for drugs. No. Okay.
We tried.
Well, except that, like, a couple economists here say that the drug costs would be lowered, even if just by 4%, because that's how bargaining works. You know, if a person is representing the entire population of a country, they have a lot of leverage. So how every other country works.
Kindly vote Bernie for re-election.
No.
Well, I mean, you know, he's not. I mean, let's do the actuary tables. It's going to be whoever is VP. Let's continue.
It's true, though.
I have no idea.
It's very true.
Yeah, I have every idea.
Yes, Bernie Sanders is the one who definitely has, like, who isn't talking in slurs and isn't. He's definitely the one crippling and almost dying. Not
He'll be dead.
Trump, who might have a brain aneurysm tomorrow.
Let's continue after that freeze frame.
First, let's talk taxes. I know. I know.
Taxes.
That's bad. But let's do it. What Republicans
But
and the
let's do it anyway.
for-profit healthcare industry don't want you to
for-profit.
understand is that we're not talking about new money. We're talking about money.
Well, yeah. I mean, imagine if fucking shit, what the company? Oh my god, I don't even know if you have this in the States. I don't even remember. Well, yeah. Imagine like the Red Cross was for profit. They go to fucking other countries and like pay us. Imagine if Salvation Army. I don't know if that's in the States or not, but the Salvation Army is basically just like a non-for-profit clothes seller, where they just get clothes and then sell it back without making a profit. Imagine if that was for profit.
That's currently being taken right out of your pocket by drug and insurance companies.
No.
Let's call this money the corporation's tax you tax. For example, the cost of an employer health plan for a family of 4 is
Does Canada pay for ambulances? Yes, I think. See, you don't have to pay for your ambulance when you take it, but I'll check that anyway. I'll just get you. Do you? Pretty sure you don't, because there's never any stories about people not paying ambulances. The cost of nurse flight and the cost of travel home after discharge by the hospital. Nova Scotia, Canada visitors pay $700 for an ordinary ambulance, while non-Canadians and new Canadians pay $1,000. So sometimes you could pay. So in Nova Scotia, apparently you pay, but it could be province by province. Because each of our Medicare medical systems is province-based, so I don't think in Ontario, where I'm from, I don't think you pay for it. I haven't heard of anyone paying for an ambulance. Nova Scotia apparently pays $700 for an ambulance. Let's see. What is the charge for an ambulance in Ontario? Let's see. The $200 charge is the average cost of a land ambulance trip in Ontario. The patient is charged the full cost of any air ambulance flight that is not medically necessary or is not covered by the valid Ontario Ontario Health Card or Health 65 card. The patient must also pay $20 on any land ambulance use. So apparently air ambulance, which is helicopter flying, if you have to be airlifted out, you might have to pay for that. If it's an emergency, I'm pretty sure you don't have to pay for it. And then a land ambulance is $240, but I don't know if this little quote here includes like you might not have to pay for it depending on if it's emergency or not. But it's only $240 in Ontario. Let's open this up though. Medically necessary trips. The ministry pays ambulance cost over $45 for emergency trip to the attending physician at the hospital signs the ambulance call report. Okay, whatever. A non-emergency trip if the patient's doctor states in writing before the ambulance is in use that the patient's condition makes an ambulance necessary. Okay. The hospital bills the patient for the $45 when no hospital is involved. The service provider pays the provider bills the patient. An ambulance costs $45 for medically necessary trip. If the patient also needs a land ambulance, $45 is charged only once. Full cost. The patient must pay $240 for a land ambulance trip when the trip is not medically necessary or the patient does not have a valid Ontario health card or 65 card. So, yeah, you only have to pay for it if it's not medically necessary or if you don't have your valid Ontario health card, which I don't know where mine is right now. I don't know where my wallet is, to be honest. But I have my health card. That's the only reason you would have to pay for it if you don't need it, basically, or if you don't have your health card with you. But if you don't have your health card with you, they'll charge you. But when you get the bill, you could probably go to the some Ontario registry or whatever the fuck and get it deducted or paid back.
$28,000, over $12,000 of which is paid directly by the employee through premiums and out-of-pocket costs. In fact, if you include healthcare premiums, the United States is already one of the highest tax.
I don't get it when the fireman shows up or the police. Even if it was cause of the fire or crime, it doesn't come out of my pocket. It makes no sense to pay for ambulance rides. Yeah, but I just said you don't have to pay for ambulance rides as long as it's not necessary. So that's why you get charged. You do pay for the police department to show up if it's not necessary. So if you call the police to show up to your house and it turns out to not be an emergency, you get a fine. That's all this is. If it turns out you call an ambulance over and you don't need the ambulance, you have to pay $240. If you call the fire department or the police to your house and you don't actually need it, you get fined. In the States, we pay for the bus no matter what. Oh, so my fucking chat. I don't know if I can change the color of that because you can't be seen because it's white. Hold on. I just need stream elements. In the States, we pay for the bus no matter what. What bus? Like, just your buses? Because same? Ambulance. Okay. Yeah. But in Canada, we don't pay. But yeah, you shouldn't have to pay. You shouldn't have to pay for an ambulance ride, unless of course you are like scamming the system, right? So if you call an ambulance and you're like, I need a free ride to Taco Bell, basically, right? Or you just want to ride somewhere because you don't actually need a medical emergency, you just want to get to the hospital, you should be fined for that or pay for that. And that's the same thing in Ontario. If it turns out you don't actually need the ambulance, you have to pay $240. If you need it, but it wasn't super necessary, you might have to pay $45. And then you might not have to pay the full cost if you need it. So, like, if you get into a car accident, I'm pretty sure that ride is free. Yeah, well, we do have a single payer system.
Nations in the world. All that
Even without them, we
corporations tax you tax is why the healthcare industry reports over $100 billion in profits last year alone.
So much wrong with this, but wait, hold on a second. You mean that employees have to pay anything for their health care? But it seems like the employers, the evil monocled employers behind a bed of pharmaceuticals, are paying for health care for a majority of Americans. Under this definition, by the way, we'll get to the 100.
Yeah, they use it as an incentive to get cheaper labor. The cost is always passed down onto the employer. You go, hey, your wage here is only $15 an hour, but you get healthcare, kind of.
$100 billion in profits. That's a really misleading number. But under the definition of this corporation reaches in your pocket tax, anytime you pay for goods or services, you're being taxed by corporations. They're talking about it being weird. Sure,
where's my water
taxes
bottle?
get passed on as.
Oh, I might have to. Yeah. Okay. I'm gonna be right back really quick. Okay. I love you. I just need my water bottle filled up really badly. Thanks for the follow, buddy. I really appreciate that. Hopefully my finger looked good.
Costs to the consumer. Someone tell big grocery, big tech app creators, and
Big grocery. Yeah, but we've kind of all collectively decided that we don't need a $20 steak as a right. We don't need a $20 steak. That's why we're allowing Walmart, any kind of like grocery store. I was going to say Zehrs, but I don't know if Zehrs exists in the United States. So any grocery store to make profit. Because there is a system that exists to give people who can't afford food. Wow, it's almost, wow. Bread lines exist. These things exist already. There is a baseline. Of, oh, okay, food is a human right. So a country should give out a minimum food to people who can't afford it. And that's what happens. You have food lines. You have shelters.
KitchenAid. Everyone.
Yeah.
But food has like, actually, well, the medical system has layers anyways. You have necessary and, yeah, the poverty line is based on dietary needs. Yeah. You have necessary medical stuff, like you have diabetes, you need insulin for, you have diabetes, you might have hep, whatever you have, AIDS, all the stuff that you need drugs to cancer, all these stuff that you need drugs to help you with, and you have electives. So maybe you want. So you have electives, okay? So instead of getting braces, you want jaw reconstruction surgery. Instead of having to deal with braces for 3+ years, you want to just reconstruct your jaw. Fair enough. That's an elective. You can wait for that and pay extra for that. That happens. Even right now in Canada, the dental industry actually isn't necessary. We don't consider it. We consider anything dental an elective. Now, I would like that changed somewhat, so that there's a baseline, like at least checks. You should be able to go in for checkups for free. Every 6 months, I think, is what usually people recommend. So every 6 months, you should be able to get a free dental checkup. But anything more than that should probably be costed. Yeah, I'm not sure about cavities and stuff like that. I'll have to look into that. But we have electives, and then we have necessary medical needs. That's why he's going to bring up the wait line bullshit. There are no wait lines in Canada unless, of course, you're trying to get an elective procedure done. If you break your leg, if I broke my leg right now, I would be trucked into the emergency room and dealt with right away. If I got shot, I would be dealt with right away. Now, if I broke my leg, and no, not if I broke my leg. If I dislocated my finger and I was totally fine, and I was just sitting there, complete non-emergency, my finger's just dislocated. I'm fine, I'm sitting there, my finger's just bent to the side. I might wait a little bit, because all it's going to take is for a doctor to just go, boonk, and now it's back into place and we're fine. And I move on. So I might wait for a little while, but because it's more on the elective side, where I can wait because I only have a dislocated finger. But there are no legitimate wait lines for necessary procedures. Sometimes this stuff gets muddled because somebody goes in and they ask for an MRI, so it's put down as an elective procedure because somebody just wants an MRI. That MRI, they get scanned and it turns out they have cancer or whatever. Turns out they have something necessary. So now it gets put underneath necessary. It gets put underneath necessary procedure, but they waited for that necessary procedure, so then it adds to the, oh, there's wait lines. Yeah. Well, there's no wait lines in an ER. Oh, I see what you're saying. Yeah. If you're not dying, you wait. Okay, yeah. Yeah, it's just that in Canada, we don't pay for it. You just get trucked in, you get your fucking bones fixed, you stop the bleeding, you get taken care of. You actually get taken care of fully, because in the United States, you just get stabilized, and then everything else is paid for. Because you have the emergency fund, whatever the hell it's called, right? Where you'll get patched up, but any necessary work after that is you have to pay for. So a lot of, I don't know if I don't know if all of you have that, if that's just immigrants. I forget how it works, but the emergency pay, whatever the fuck, people say that immigrants take advantage of it all the time. That's their free healthcare, is they just walk into the emergency room with a common cold, which doesn't happen. But yeah. Anyways.
I'm an OXO man.
OXO, huh?
Cuisinart.
Great stuff.
Best egg
This
slicer
is
ever.
Brayville. And the warranty's not so generous, but that's why I have my Amex. So they're not a sponsor. They'll be pissed. So the sleight of hand here occurs here. Do you see what they say? $100 billion for the healthcare industry in profits last year. Okay, this is important to note because this is the kind of, it's not just as false as the previous study that they cite with the man saying, stop citing me.
Exactly.
That's not what I meant. But this is pretty misleading. I don't want to say dishonest. Maybe they don't necessarily know better. But what possibly could be misleading when you are citing a statistic, $100 billion in profit for the entire healthcare industry? Can anyone think what it is? Why would it? It's not a company. It's just general profits from an entire industry. Okay, that's important to note. For scale, look at the food industry, $137 billion in profits.
Food is a human right.
Yeah. So he just yells out, "Food is a human right." Yeah, we agree that food is a human right. That's why there's fucking bread lines. That's why those things exist. So that there's a basic level of food given out to people. If you can't afford food, you can go and get free food. That already exists. But in the United States, if you can't afford healthcare, you don't fucking get healthcare. That's the bottom line. So bringing up all these shitty numbers about people making billions of dollars, those aren't necessary things. Or if they are necessary, there is already a baseline, basic availability. I think the guy said $100 billion by the healthcare industry. But regardless of that, the numbers don't matter because there's no, like, the numbers matter for the healthcare industry making money because there's no baseline. So he's making a comparison that, like, oh, the healthcare industry made $100 billion. Well, the food industry made $110 billion. Well, yeah, because there's already a baseline of food. There's a base. You can go to a bread line and get free food. There's food banks. There's all these things that exist that you can get free food at. So there is already a baseline for free food. So we don't care about anything else. We don't care about profits past that because we know that every single citizen will get a basic amount of food to survive. We know that. But for the healthcare industry in the United States, that doesn't exist. These people are making $100 billion in profit. The whole industry is making $100 billion in profit, but there is no baseline. Not everybody has access to the healthcare while a bunch of people are making money. That's what you're trying to change. You're trying to make it so that everybody has access to healthcare, and then people can make profit after that if they want. That's what happens in Canada, where we have a single payer system. Every single hospital in Ontario, at least, I don't know about it, in Ontario is private. Every hospital is private. Every doctor is privately, as a private employee to a hospital, and they make money. Because all the Canadian government is doing is bargaining prices to the hospitals. That's it.
Tech industry.
We don't have a nationalized service. We just have a single payer bargaining chip. The Canadian government goes to hospitals, goes to doctors, goes to drug companies and says, we are paying this. We would like to pay this much for drugs because we are an entire citizen. Like, we are the entire fucking population of Canada.
The top three companies alone, $130 billion in profit.
Well, that's
now
crazy.
for scale,
Okay.
the biggest insurer, health insurer, United Health versus, let's compare a company to a company. And this is really important, by the way, because the healthcare industry as a whole is not what is spearheading innovation. These are not the people who are creating new products. It is companies within an industry competing against each other. Just like Apple invented the iPhone. We don't say, if you look at the profits of the entire smartphone industry and attribute the profits of the iPhone. No.
Right.
What?
Samsung would love to get in on that action, but your phones exploded.
No, but we aren't asking for a basic amount of telecommunication to be get. Actually, we are well, some people are, and I would agree with that. That we should have a basic level of telecommunication between everyone.
So we look at companies, the individual company who wants to be profitable. They are going to create, I don't know, the cure for the polio vaccine. It's not everyone pooling their resources together saying, hey, I bet you if we all just came in together, we could have 100 billion in profits. No, companies want to make their name. They want to make their money back. Exactly. We'll get into how they do that in a second, but just naming an industry is not an accurate measurement here. So let's compare apples to apples. Apple themselves made over $59 billion in annual profits.
Why do we care about Apple making profits over a healthcare industry? The health insurance industry net earnings $23.4 billion. Yeah, so the guy was probably saying $100 billion, which would be insurance, drug companies, and then like whatever else. That's the real scam, man. Well, like, it's okay that the health insurance companies make that much money as long as everyone has coverage. So the problem is that they're making that much money without everybody having coverage. So I'm pretty sure, well, there's no insurance companies in Canada. It doesn't exist besides for elective procedures like dental. But we can look at like how much money so this is the RVH. This is the hospital in my city. Okay, I don't need this. Careers. Average salary, $36 per hour. So for a registered nurse, for an RN, you get $36. Manager, $55. Nurse practitioner, $53. Pharmacist, $51. Social worker, $45. You're making fucking bank at these fucking places. Nurse practitioner, so this is nursing, popular jobs. Medical technician, patient assistant, technologist, medical technologist, sonographer, laboratory technician, service clerk. So $20 an hour for most of these things. Manager, consultant, supervisor, philanthropist. Philanthropy manager, quality assurance, therapy, physiotherapist, occupational therapist, speech linguist, rehabilitation, social worker gets $45. Social worker, yeah. That's the average. That's the average at my at the hospital near me. What are they making though? Well, they're clearly making something if they're expanding. Working in a hospital. 15 to 25. Jesus Christ. Nice meme. Yeah, they get paid $45 an hour. Well, $45 Canadian, so. So $45 an hour Canadian. Oh God, is $33. So okay, still way more. How much money? So these are executives, so they make $100,000 a year, blah, blah, blah. CEO. The CEO salary is $276,000 at the Royal Victoria Hospital in Barrie, Ontario. $200,000. How much does the Prime Minister make? $178,000. Our socialized healthcare system pays our CEOs way more than the fucking Prime Minister. Salary, 700, 300. Or that. What the hell is this? Total compensation consists of members of however. Oh, okay. So yeah, in total that. I think. What was it saying? Okay, we'll say this. So more, $100,000 more. Amazing. Okay, I can't find the profits of the RVH, but it's okay. Surgery, patient, family guide. But the executives, I guess this gives us a decent number, is that the executives get paid $200,000 for being the CEO. Oh, and she receives that much in a pension plan. Okay. Okay, so the compensation package. So in total, she's receiving $440,000 in like in total value. And it doesn't really matter, but yeah, you make bank for being a CEO of a fucking hospital in Canada. The socialism
versus United Health, evil Monocle's health insurance company, $14 billion.
Yeah, okay, so he's saying that Apple, a company that sells phones and other services that aren't necessary, made a bunch of money.
That's what we might call statistically significant. Monocle's $59 billion.
They made $59 billion versus a health industry, which is something we believe is necessary for all human beings, made $14 billion. These numbers, one is supposed to be viable under capitalism, Apple, who gives a shit about selling fucking phones, and one is an industry that we believe is necessary for all human beings to survive. These numbers don't fucking matter. I don't give a shit how much money Apple makes. Their phones aren't, well, their phones are becoming more and more necessary for human beings, but it doesn't matter. They can still make that much money because what will probably happen is that there will be a baseline phone that's just a shitty fucking phone that everyone can buy for $5 fucking. And then that problem is solved. Or there'll be other things happening.
In annual profits versus United Health, evil Monocle's health insurance company, $14 billion. That's what we might call statistically significant. And lest you think that it's absurd to say, well, they can do that with anything. Germany, they declared the internet a human right. By the way, there's now an argument to be made, and actually I think the government sort of in a backhanded way has recognized this, that people can't work today without smartphones.
Yeah.
So now you can, remember the Obama phone lady?
Well, it's not that you can't work without a phone. Well, you can't a lot of times. It's just that you can't function as a citizen probably without a phone these days, right? You have people that need to call you at any fucking moment in the day. You have to be, not everybody's at home all the time sitting around their fucking home phone, and people get pissed off if they have to leave a fucking message. So you need your fucking cell phone on you because you're fucking running around doing all this shit, and people need to call you. So if you don't have a cell phone with you and you only have a home phone, you're fucked.
Obama got us a phone!
Because when you're home, you're out of working hours, right? So like if you're at home, it's after 5 o'clock, the work shift is done, you can't call those people back, so there's no point in time where you can call somebody back because you're never home when somebody's at work.
That's right, baby.
I love that. What do you think about Mitt Romney? Mitt Romney sucks! I feel that way about Mitt Romney now. Obama phone lady was an oracle.
Pathetic indeed. Yes.
Mitt Romney's a pussy!
Way ahead of her time.
You and your cricket phone. So, you just declare anything a right, well, then there you go. You can simply subsidize it. Let's start by subsidizing, I don't know, Apple, Coca-Cola. Let's look at...
What? This is so dumb. Like this, yes. If we declare something a human right, you need to be able to provide a basic amount to every citizen. Duh. That's how rights work. I'm sorry to break it to you, Crowder. Rights aren't given to you by God. It's not how it works.
Look at any company they have more significant profit margins than the healthcare industry. And by the way,
Yes. But the profits of Apple, or the product of Apple, isn't necessary to every human being. And once it is, they can still make profits on their elective products, we'll call them, like the fucking brand new Apple X, whatever the fuck, this fucking shit phone that everyone needs. You can still buy that, and Apple can still make $59 billion as long as they provide a reasonably affordable phone that anybody can use, that can just text and call. That's what I would assume would be a step, would be the first step when we decide that yes, phones are necessary. It would be that every company, or maybe companies, can combine together and make a very cheap, shitty phone that any fucking person can have. Or the other option is that you make, because there's a lot of $0 phone plans out there, but you make like subsidized phone plans. Anyway, it doesn't matter.
The reason insurance is so expensive is because there's a lack of competition when you compare it to other industries. Not more. Single payer would not help with that. You want to look at industries where...
Actually, no. The reason why insurance is so expensive, and it says it in this article, is that because there's so much fracturing, there's not one strong arm that can leverage a bunch of people. That's how unions work. That's why unions don't work when there's a fuck ton of unions, because it just ends up being individual people. It turns out that individual people have a don't have any leverage over a massive corporation. That's why you can't go to Walmart and be like, $20 shirt, I'll pay you $15 for it. You can't fucking do that. You have to get a large body of people together to boycott. If you want to reduce the price of a shirt, you have to boycott a company and not buy that shirt and let the market correct the price. So, same thing with drug companies and insurance and all stuff like that. If you get everybody together under one insurance provider, the United States government, you have a lot more leverage over the drug companies and any other medical costs.
We have skyrocketing costs. Look at industries that are the most heavily...
That's why, also, to add this on to other thing, that's why countries like Denmark don't have a federal minimum wage. It's because their unions are so powerful and so massive that they can give a living wage to their workers. So they don't need a federal minimum wage, because having a federal minimum wage might hamper their might restrict their bargaining power, because a company might look at the federal minimum wage set by Denmark and go, hey, the federal government has said that you only need this much, so we're only going to pay you this much. But if that doesn't exist, then the unions have a chance to go, hey, we believe that $26 is good pay for this work, blah, blah, blah.
Regulated. You can look at healthcare.
Thanks for the follow, by the way.
Education, and you can look at healthcare, education, transportation. You thrilled with the airlines, folks? Here's something that Bernie doesn't.
No, I want rail systems to be built all over the place, like in the Green New Deal. You're harping on the airplane industry. Why don't you agree with the Green New Deal? They want to get rid of the airplane industry and change it all to trains. A much cheaper and more efficient mode of transportation around the country.
Address in the video, or the campaign officially, Archer he speaks for Bernie, who will actually be taxed under this proposal. Now, they claim in the video, right, that it would only be the super rich.
Right.
Okay? A little bit of cold water here. If you were to confiscate the wealth of all billionaires, not in the United States, in the entire world,
wow.
Billionaires in the entire grit-eaten world, it wouldn't pay for 3 average years of Medicare for all.
Dang it.
And if we really wanted to fund Sanders' plan, it's estimated
What I don't-
by economists, people who Bernie sometimes cites, and they say, stop doing it.
So I want to dig into whatever numbers he's fucking talking about, but I don't know where to find. I was trying to Google the total profits of all like top 50 billionaires, but what I'm assuming he's doing is he's just saying grab the net worth of all the billionaires in the world right now, and how much could that pay for a healthcare system over for however long. But he's not taking into consideration that profits and net worth go up per year. So we don't need to hoard $100 trillion or whatever. So he says 3 good years, so that I think it's $3 trillion per year. So the entire world of billionaires only has $9 trillion in total. But that's if you hoard it all right now and don't bring in any extra revenue over the 3 years you're paying for it. But that's not how that's not how taxation works. That's not how profits work. That's not how fucking people's wealth works. Right? Like, you're making money on the money, so you tax it, and then you're making the more money, and then you get taxed more if you're making more. So as Jeff Bezos's net worth goes up, he pays more in taxes. We don't need to just hoard his money right now and then pay it off slow, because he'll make more money. So we'll be able to tax more money. We might take $1 trillion away from him right now, but in 2 years from now, he might have $2 trillion. He might have and then all of a sudden it's easier to... Anyways, it's stupid to be like, let's just... If we grabbed all their money now, we would only be able to pay for... Yes, if I made $100,000 in a year, and I took all of that money and paid and wanted to pay for private schooling for my kids that cost $10,000 a year, I'd only be able to pay for 10 years. I'm not being dumb right now. 10 years of schooling. I'd only be able to pay for 10 years of schooling. But that's not taking into consideration me making $100,000 per year. That's only taking into consideration 1 year of my worth. 1 year of how much money I made can pay for 10 years of my kids' schooling. But I'm making $100,000 per year. Every year I could pay for another 10 years of my kids' schooling.
Stop. Don't do that anymore.
You're lying.
Stop doing it. Stop doing it because you are misleading and I could hurt you.
And I'm an economist.
It's estimated that we need to double all personal, corporate, and triple, I think triple payroll taxes. I think we have it, Washington Examiner and Bloomberg there.
Jeez.
By the way, what's a payroll task, you might be asking? Well, I want to make sure that I read
Payroll
this
task?
just so you're clear. Because a lot of people, if you're an employee, not necessarily an employer, this might be somewhat foreign to you.
Right.
A payroll tax is a tax withheld from an employee's salary by an employer who remits it to the government on their behalf. The tax is based on wages, salaries, and tips paid to employees. Payroll taxes are deducted directly from the employee's earnings.
So this, what I found is hilarious. So I always thought, well, I still think that it's ridiculous that I have to do my own fucking taxes, because it only ends up being that I'll make a mistake and I'll get fucked and I'll have to pay my fucking money to the government, even though they already know how much money I owe them, so they could just take it out of my fucking bank account or take it off of my payroll so that I don't have to worry about it. But I realize now why they do that. It's because shitty fucking conservatives like this idiot say, oh, well, it's better if I just have all of my money and then I paid my taxes my own way, because I am better at doing my taxes than a accountant or the government. So I'll do my own taxes because I can't trust the accountants of these big corporations, and I can't trust the government to do it. So I'll do it myself. That's why. Because we have idiots who think they can do their taxes better than somebody who's fucking educated on doing it. Who literally, their entire existence is predicated on them making you more money. Loopies. Yeah, also loopholes. But I'm just talking about like in broad, like every citizen, right? Like we don't know about loopholes.
Paid directly to the Internal Revenue Service, the IRS. I go by the full name here because I want to be accurate. By the employer. Hold on a second. That sounds like an actual corporation passing payroll taxes down to you. Remember they were talking about this? It's the corporation reaching in your pocket.
Yeah.
Let me ask you that. A lot of you may not know. Hey, I actually have to pay payroll taxes on every last one of you ungrateful shits. Would you rather have that money in your pocket? It's going to Uncle Sam.
I would love it.
Sorry, screw you. You have no choice.
Come on, why not?
That's a few grand a piece. That'd be one hell of a baby crib there, Audio Wade. I know that you are with child, but...
I don't understand this, because you wouldn't, like, it's either that the payroll tax doesn't exist or it does exist. So you can't, I'm pretty sure you can't you can't forward the payroll tax onto your employees, because it's the same, like if you pay them less, you still have to pay taxes on the less money. So unless, of course, they all just get paid fuck all. But who would work for fuck all? Like the whole joke of the conservatives is that people, right? I don't get this point, right? Because if he thinks that payroll, so let's run through this, okay? He thinks that payroll taxes are bad because you're taking $1,000 away from a worker. So his wage is effectively $1,000 less than what it should be, what I'm willing to pay them. Okay, but you're not paying, like, if you increase the wage by $1,000 to give them what they're worth, so let's say you're paying a guy $2,000 an hour, But you want to pay them $3,000 an hour, but the government taxes them $1,000. Okay, so you want to pay them $3,000, and you are paying them $3,000, but the government takes away $1,000. You could pay them $3,000. You're already price gouging them. You could pay them $3,000. So I guess his argument is that he's forced to price gouge. He wants to pay them a $3,000 an hour, but he can't because of the government. So he pays them $2,000 an hour. Is that his argument? That must be his argument. It sounds ridiculous in my brain. Let me run it over a couple times. Okay. Yeah, we know that if the payroll tax doesn't exist, let's say tomorrow the payroll tax is expunged from the universe, you're not going to increase your wages of your workers by $1,000 an hour to the $3,000 an hour you want to pay. You're just going to pocket that money. Why wouldn't you? You're already paying them $2,000 an hour. Why wouldn't you just pocket the money instead of giving them? Why would you give them the money? They're willing to work for $2,000 an hour. Why would? Yeah, what the? Okay. And yeah, what? Yeah, this is really dumb. Because like you have to ignore all the benefits that come from what gets paid for via payroll tax. Why would a company give you the money if a payroll tax doesn't exist? Most of the time, if you're an idiot, you can ask for you not to be payroll taxed. So you can do a snaky thing, at least in Canada. I've been asked if I want to do this. I've said no every single time because I don't want to do. You can ask for, basically, you can ask a company to give you the full wage, and then you'll pay for your taxes later. And this gives you the false assumption that you're making more money. When you're not, you have to pay that money back in taxes anyways. So you're not making more money. And you're most likely just getting yourself a big fine from the fucking government. Yeah, this is just a dumbass argument. So, yeah, okay.
Life's gonna be tough, kid.
You're paying, like why would you pay them? If you wanted to pay them more. Right? If you think, like, this is just an excuse. It's just, like, saying that the payroll tax is a barrier is just an excuse. Because if you, as a company, are paying a wage of $3,000 an hour and $1,000 an hour is taxed, so therefore you're only paying your workers $2,000 an hour, and next year the payroll tax gets expunged, so now you can pay your workers. You're not going to pay your workers $3,000 an hour unless, of course, they ask for it. I get, like, all the workers would have to be like, yeah, I deserve way more money now, so give it to me. And then you might give them more money. But most likely you might not, and then you're just going to pocket the payroll tax. Because why wouldn't you? Would make way more money.
I'm sorry, I love you. I'm just saying, just if you knew how much I have.
So, like, he's either admitting that he passes the payroll tax onto his workers and he's fucking them, or he's paying them what they're worth and he's just eating the payroll tax like a normal human being.
To pay just to have you just to pay. You know what? Fine. Okay, that's cool. I'll pass the costs on to the employees. Enjoy. Thanks, Bernie. So.
Yeah, so all he's doing is being a scumbag, but he's passing it on to the government as, oh, it's not my fault you're getting paid less. It's the government's fault. Even though they take those taxes and give you a bunch of stuff.
Who falls under this super rich with the Bernie plan? Right, here's something. He let it slip.
Uh-oh.
If you haven't seen his clip, it's anyone making over $29,000 a year. See if you can spot it.
Is healthcare free?
Yeah, but then he also mentions that it's progressive. It's a progressive tax system. So if you make over 20, there's his budget's over anyways.
No, it is not. So what we do is exempt the first $29,000 of a person's income. You make less than $29,000, you pay nothing in taxes. Above that, in a
You made a mistake and said 25, so...
progressive way with the
So if you make over $29,000, in a progressive way, you pay taxes. So if you make anything under $29,000, which... So if you're in the middle class, you might be paying a little bit more in taxes. Which income class are you? I think this is one I clicked before. So lower income, 25,000. You're not paying for Medicare if you're in the lower income bracket of these states. Middle income, you pay more in class. Wow, that's a fuck ton of money. All right.
the wealthiest people in this country paying the largest percentage.
Okay, hold on. I understood a lot of words there that you want me to hate rich people and you like progressiveness. I understand that, but if I make more than $29,000 a year, will I be paying more in taxes? Yeah, but the rich still pay more. Well, I have to. Yes.
What a reductive argument. Well, see, Medicare can't work because if you make over $29,000, you have to pay more. Ah, fuck, I can't agree with this. I pay 1% more in taxes. You can do Bernie's tax plan. Even though I don't think this has been adjusted in a while. Let's say you make $29,000. It's 200. Your effective tax rate is 8%. Oh, 8% is more than the current system. But wait, my disposable income is lower than Bernie Sanders. Why? Oh, well, because you spend $2,000 on annual healthcare spending on average. Whereas for Medicare for All, you'd only spend $672 in taxes. So that is the 2%. Holy shit, you have more disposable income. Okay, what if you make less than that? Let's say you make $25,000. Oh, shit. $25,000. Well, your effective tax rate is 7%. And you still have more disposable income than here. Okay. What if you make $30,000? Interesting. You still have more disposable income. So you make $300,000. Oh, you have more disposable income under the current plan than Bernie's plan. When you make $300,000. Wow, okay. So this is when you're getting into the rich territory. And now you're paying, look at that, 29%. So when you get to the mega rich, what is that? Is that $1 million? Let's go with 10 million. Let's go with $1 billion. Fuck it. You're paying 56%. Oh my God. Oh no, you only have $400 million. Yeah, you only have $400 million to deal with. Holy shit. Whereas currently, under this system, you have $600 million. Oh my. Holy shit, dude. Wow, it's like you're getting taxed more when you're super rich. Holy shit. Look, you're only getting taxed 12% between $9,000 and $38,000. Oh my God. And then you get taxed progressively more as you go down the line. Up to 52% on a progressive tax rate. Which, if you don't understand how that works, I'll explain it. But that's okay.
Eventually.
So, like, if you're so butthurt that you have to pay, you don't even pay more. You only pay more. Yes, you pay more than the current tax rate at above $250,000 a year. Everything else is exactly the same. Every other percentage. First bracket, 10%. First bracket, 10%. Second bracket, 12%. Second bracket, 12%. Third bracket, 22, 22. Fourth, 24, 24. Fifth, 32, 32. So that bracket, and then the what is this? Fifth, 1, 2, 3, 4, 5, 6. Sixth bracket, 35%, 35%. But the fifth bracket ends shorter. So the fifth bracket is from $200,000 to $250,000. Above $250,000, you get taxed at 40%, whereas above $250,000, you still get taxed at 35%, up to $500,000. So you get taxed more under Bernie Sanders' plan if you're making over $250,000 a year. Everything else is exactly the fucking same.
You will in fact be screwed. Yes.
So he's just talking about that this bracket, this tax bracket here, this middle, halfway in this middle tax bracket, the 12% tax bracket. So like if you make, well, let's bring the number back down. Yeah. So if you make $29,000, you don't have to pay, sorry, you do have to pay the 672. But if you make, I don't know if this shows it on this map because it's annoying to do. But if you make this, you don't pay this. If you make $28,999, you don't pay the $671. You don't pay it. Because of the standard deduction, families of 4 making less than $29,000 a year will not pay this premium. So if you're a family poor, 4, let's say if we go marry jointly, go with this. Yeah, you're paying way less. You have a 2% tax rate. Holy fuck. What are the other options? Widower, head of household, separately, with marry jointly still, yeah. So you're just not paying as much. Anyway, it's dumb. It's all dumb.
So just so you understand, he almost said 25,000 there. So he was so confident.
Yeah. They upped the number.
That was him cleaning up his.
No, he doesn't up the number. I'm pretty sure this has been the same forever. 29,000. He just made a mistake. It's okay, guys.
Yeah. 25. 29. Son of a bitch.
This is important if you're on board with the idea that wealthy people should pay more just because they happen to employ people, and you hate the millionaire, billionaire, or over 29,000-aire class.
No, we don't hate millionaires. We mostly hate billionaires. Only fair. No, sorry. What was his name? What's his name? Fucking Harkdan? Sorry, Harkdan. I have to disagree.
Where does the money that is taken from the triple payroll taxes and personal and corporate tax, where does it go?
My rebuttal to your flat tax is this video right here. This is my rebuttal to your flat tax. Is this.
For my nurses.
How many millions can I have and not be hated? About 999 million. Probably. Well, for me, I don't care. I mean, billionaires, I don't even hate billionaires. I just think you need to pay more. I just need to think that you just need to pay a fair in the United States. I live in Canada. I could go to Canadian tax plan. Whoa. Canadian tax brackets. Even though this is different via, we'll go with the federal tax, and then this changes for the federal level. Yeah, okay, well, it does actually show my, okay, anyways. So, Ontario, my province. 5% on the first $43,000 of taxable income. 13% on the amount over, let's just go get fucking Ontario's tax bracket. Ontario's tax rate. I like how fucking provinces in Canada work better than what you guys love in your states. Like, you guys think that the states should run everything, and yet in Canada, provinces run more shit than your states do. With a flat tax, billionaires do pay more. No, but it's regressive. No, they don't. You need to show me what you think is a flat tax, because it's regressive, which means that poor people pay a higher percentage of their income or of their worth than the rich. Federal, 15% on the first, 33% above that. Ontario, so that's the federal. 33% on income over $205,000. So that's pretty fucking low for a parent socialist country. And then Ontario, on top of that, you pay another 13%. So 46%. What's 10% of... Yes. Okay, here, I'll show you. I'll show you why. 10% of 30,000 is 3,000, right? Do I use this for divide? Yes. Whoops. Oh, that's the wrong number. That's 1%. Ah! Let me go back. I hate this. About $3,000. What's 10% of... Yeah, so that's... Okay, here... Okay. So three... How do I explain this to you? Okay, so if you get taxed... So here's the problem. So $3,000 to somebody who makes $30,000... So, okay, let me... Fuck off. Canadians with calculates. Nice meme. So, what is it? What number? You want $1 million? Oh, fuck off. So, that's 900. So that's $80,000. Let's go with, it's supposed to be 90,000. I don't know why the fuck. Anyways. Oh, it's because I'm doing the... Anyways. I could just do this. I don't know why I'm doing this. 1 million divided by 0.0. Okay, there we go. That's what the number's supposed to be. So, what number did I put in? 1 million? Why am I getting 10 million? Oh. Oh my god. I'm supposed to do times. Jesus, I hate this fucking calculator on the fucking computer. Times. Fuck me. Yeah. No, don't move the decimal point. You just, because that's 10%. That's 10%. You just have to do times, or you just have to do times. Is the reason. But I keep on missing the button because I have to use the fucking... Oh, fuck, I can't lift this. Since you have to use a keyboard, you have to use these fucking shit buttons, but they're right next to each other, so I fat-fingered the divide by button instead of the times button. Every single fucking time. Anyways, so that's $100,000 for somebody who makes $1 million, which is 10% of their wealth, but that means they have $900,000 to deal with, right? So they have $900,000 left to deal with. But if you make $10,000, because we'll make this comparable numbers, you have $9,000 left to deal with. So the same percentage is being taxed, but you have way more money. Like if a living wage is $5,000 a year, let's say you only need $5,000 a year to live, okay? Why did my sound stop? Whatever. I need to mute that game. Anyways, it doesn't matter. So if a living wage is $5,000 a year, then I am only, if I make $10,000, I am $4,000 away of the poverty line. If I make $1 million, I am I'm $895,000 away from the poverty line. That's why flat taxes suck. Sure, you're getting taxed the same amount, but 10% is worth a fuck ton more to somebody making $10,000 a year than 10% is worth to somebody making $1 million a year. Comprende? If you want to talk about this more, you could hop into Discord. We could run this through voice to voice. Flat tax on third. Yep. So a flat tax on 10,000 would be 1,000. So again, $10,000 to somebody who makes, $3,000. Sorry, 10% to somebody who makes $30,000 is a lot more money in terms of their value than somebody making $1 million. $10,000 to a millionaire is fuck all. $3,000 to somebody who makes $30,000 is a lot of money. Wouldn't you agree? That's a year's worth of car payments. Yeah, sorry, $100,000. $100,000 to a millionaire is not a lot of money. My bad. Because a millionaire who gets taxed, who loses $100,000, still has $900,000 to deal with, whereas somebody with $30,000 only has $27,000 left to deal with. The cost of living. Let's say the cost of living is $25,000 a year. I know it's an example. Yeah, I know how. I'm telling you why it wouldn't work. Because the millionaire has $900,000 left to deal with, whereas the $30,000 a year guy only has $27,000 to deal with. If the living wage is $25,000 a year, that person is $2,000 away from the poverty line. Whereas the millionaire is $873,000 away from the poverty line. You're hung up on stealing. No, it's called a progressive tax rate. It's called distributing wealth. You're just hung up on you're just hung up on equalizing taxation. I could just play that game with you. You're hung up on, equality means the same tax rate for everybody. That's what you're hung up on. And if you want to say that I'm hung up on, then okay. I have empirical evidence that shows that flat tax doesn't fucking work, because it doesn't fucking work. We can go talk to Destiny right now. I'm joking. He's A, not streaming. B, no way I can contact him. Now, if you want to flat tax certain things, you might have an argument. But if you just want to run an income flat tax, that doesn't work. If you want to run a broad flat tax over everything, that also doesn't work. But maybe you want to flat tax some things, and we can have a discussion on that. Maybe a flat tax on certain things might work. The evidence is that $3,000 is worth a fuck ton more than $100,000 to a millionaire. $3,000 to somebody who makes $30,000 makes them $2,000 away from the poverty line. $100,000 makes almost no difference to a millionaire. So if a billionaire gets taxed at 10%, he is losing $100 million, which we know means fuck all to him. We know that. Jeff Bezos makes that in a month, I think. How much does Jeff Bezos make a second? Where is it? Hour, day, second. Oh, fuck off. Ad blocker bullshit. Get away from me. He makes 78... Is that a billion? Jesus fucking Christ. So he makes $2,000 a second. So he makes as much as the $30,000 guy gets taxed a year in 1 second. $100 million to this guy means nothing. Means absolutely nothing to this guy. Means fuck all. He makes what the $30,000 guy gets taxed in 1 second. $0 in taxes. Because of loopholes, not because of a progressive tax rate. Why wouldn't a flat tax have loopholes? Just having a flat tax doesn't mean that there's no loopholes. right? You can have a progressive tax rate with no loopholes. You can have a flat tax with loopholes. If you distribute the flat tax incorrectly, then it would have loopholes, right? So if you have a flat tax on all wealth that's in the United States, then you just offshore all your wealth. You don't pay a flat tax. Similar loopholes could exist in a flat tax system. Yes, okay, then I say progressive tax rate, no loopholes. Progressive tax rate, no loopholes. Done. So now we have two tax systems that don't have loopholes. So now Amazon does pay a progressive tax rate, so they're paying a fuck ton of taxes, whereas in your flat tax system, they would be paying almost nothing in taxes, which means fuck all to them. Progressive system generates much more revenue than a flat tax system. Of course. You can't deny that. Because your argument against it is that you have no loopholes. But I want a progressive system with no loopholes, so you want a flat tax with no loopholes. Okay. This is pretty much the Harkdan argument. So we could just watch this video. Or you could just watch this video and... Yes, because of loopholes. I want a system with no loopholes. The same way you want a flat tax system with no loopholes. You want to hop into Discord so we could talk about this more like coherently instead of with texts? Because there's like a delay and all that stuff, and also your messages aren't showing up because all the fucking screen is white and I forgot to change the color. Why? Let me sign in. Yes, I'm in Canada. What can I change? Nope. I changed the. I'll figure this out later. I probably have to like restart the stream to get it going anyway.
Time to stop.
In your opinion, nice meme. Okay. So then just go watch this from Destiny. We have the same opinion on a flat tax, so you can just go watch this. He's American, so there you go.
And that music, where is all the money going? Why is it so expensive?
It goes into CEO's salary. Sometimes it goes into magnificent I
mean, you could have a flat tax that can't. It doesn't matter. Whatever. Just, nice meme.
Atriums in hospitals while they're closing down other community hospitals.
Can you believe? Can you? But I know some of you are wondering.
Wow.
Some of you are wondering. No, I can't. I cannot believe. I cannot believe that your source there, your reference, was a random nurse. Say, this is one of the biggest, most heated political topics of our generation. For some perspective, we go to fat activist nurse from WOOD9 of Grand Rapids, Muskegon, and Schenectady. What's your opinion? Atriums? I don't know.
Tri-Cities.
I'm just here for the coffee and Oreos. Now, let's look at some of the actual numbers. Does the money go right now with private insurers? Does it go just to big atriums and CEO salaries? I mean, I don't know, maybe? She's just a nurse talking. I wasn't able to verify it. They have yet to ask the most important question here. Does all of this result in better care? Oh. Not even close. Listen, and this is one thing. You can go back to some of our previous videos. I think I'll link it in an end card here so you can see it. There are two studies that people use to try and claim that these other countries have better healthcare. There's the Commonwealth, where it studied, I think, 11 countries in the United
What's annoying is that he's conflating what better healthcare means. So he's ignoring accessibility as a reason for better as a marker for better healthcare, right? So he doesn't give a shit that 40 million people can't even access the healthcare system. He just cares that the MRIs in the United States are better than MRIs in another country. Okay. Well, all right. So then your argument just boils down to, okay, Americans have to bite the bullet, and 40 million of you don't get access because you're too poor. Sorry to break it to you. You're poor. You don't get access. Move on. Get a better job. Bootstrap. That's what the argument boils down to. We know that. Okay.
United States was 11 on that list versus the UK, who was 1. There was another one, the international study, that had us right below Slovenia and above Cuba. So
Canada doesn't have... Yeah, I'm sorry to break it to you. Our numbers are comparable. There's a gauge. I forget what it's called, but there's a gauge that once you're past a certain amount of population, it doesn't matter if you have 300 million people or 40 million people, the numbers are comparable. I forget what that's called. I wish I could bring it up. But basically, yeah, our two countries are comparable in terms of like how populations work, because once you pass a certain threshold, it's all pretty much the same. How can I describe it? It's basically, if you know how, like, hopefully you're not a flat earther, but you know how or the sun. Okay, this is, you could think of this in two ways. The light from the sun is parallel to us because the sun is so far away that all the light, the angle of the light is so minuscule, it's pretty much parallel. So the same way, and then the other example of this is that the Earth appears to be flat to us because the Earth is so massive that the curvature degree, right, from flat to curve is so minuscule, you could consider it flat. You could consider it like parallel. So the same way that the population is so massive that the difference is so close to, that's basically parallel, right? Canada can't decide what language to speak, and you want to run. It's called French and English, and we're introducing more native languages because it turns out that you can have a lot of. You can't even decide what language to speak. You guys are fighting over. So there's a bunch of Hispanics in your country, and you're like, oh, fuck them. So what? Yes. So I'm assuming you're gonna be trolling now, saying that the Earth is flat. That's okay.
I mean, what's the scale here? They're almost entirely subjective.
But regardless, even on a flat Earth model, the rays of light from the sun. Oh no, you probably think it would be a lamp. So I guess the other way to describe this is that if you have a well, it doesn't matter. If you have a circle that is so massive, the edge of that circle appears flat, right? You have to agree with that, right? If something is so, when something is so massive, the difference in angle or degree becomes so minuscule, you are better off describing it as parallel. Yeah, no, I know. That's why I'm allowed. That's why I said, yeah, go for it. That's why I'm trying to find a different way to describe it if you are like trolling. So yeah, the two, basically in total, the two populations of both of our countries are comparable because the numbers are so massive. There's so many people in here that the difference between is pretty much parallel. Fish for muskie? No. I don't know where the nearest lake is, but I don't fish that often anyways. I wish I did, but I don't feel like. It's also winter, so everything's frozen. Can you fish? Yeah, you must be able to. Oh, nice. Ooh, that's a big boy. That's a big boy. Planetary. Where do you go? What lake is it? Wow. Yeah, but it's the middle of winter, so I'm wondering if I can go catch muskie right now. Fall muskie fishing, fall bait, best fishing tips for catching muskie, crankbait. I don't care about this. I want to know where they are. You'll find muskie at Ontario's Lake of the Woods. Weedy bays, shorelines. The bait. Okay, well, fuck it all. Whatever. I don't know where the nearest lake is to catch muskie is to me. But whatever. They can caught through ice. Yes, I know. That's why I'm looking for where I could catch. Okay.
Objective polling data. That's what they consist of. So the United States objectively leads the world, not even close, in access to medical technology like MRIs. You're 4 times, by the way, as likely to die in a UK hospital than in the United States. Yeah. They have notoriously...
So that study is fudged because if you're in a hospital, like, so in the United States, because so many people can't afford it, can't afford to stay in hospitals, you end up just dying. Like, in the UK, you would die in a hospital. In the United States, you would die at home. So the studies are fucked because instead of dying in a hospital, because it's free and you can stay there, you end up just dying at home in the United States. So the numbers would line up if people were in hospitals. But people just aren't in hospitals in the United States because they can't afford to be in there. So it's not that United States hospitals are better and keep more people alive. It's just that people aren't in the hospitals because they can't afford to be in them, so they die at home instead of in the hospitals. Whereas in the UK or any other single-payer system, people will die in the hospital because they're allowed to stay there and can afford to stay there because it doesn't cost them anything. So you can't bring that number up. Sorry, break it down. True. That's true. But I was just... The medical care stuff, I do agree. The Medicare stuff is just fun to bounce my thoughts on. And that's why I'm looking at... I know he's trash. But, I mean, I have 3 viewers right now, so it's somewhat working. And it's just... I enjoy... Thanks for the follow, by the way. I enjoy just kind of bouncing off the ideas and refining arguments more and seeing where... Because he has 4.3 million people who follow him. So if I can talk to at least one of them... he said he's trash. Nice. So if I can at least talk to one of them and, like, you know, it would be great. But that never happens because none of them will ever talk to you. Because 90% of them, oh, that's a good number. But a lot of them who have opinions have no, like, you know, they don't want to be online. They have a bunch of no avies. So there's a whole bunch of no avies because they don't want to actually talk to anyone. They just want to run incognito all over the internet. So you got the no avies everywhere. I follow Crowd. Yes, but do you want to get on a Discord call and talk about stuff? Probably not, because I've asked you 3 times. If you do, great. We can. You seem to be trolling on some of the stuff. That's fine. You can. But I'd rather have, like, a more, you know, connected talk. We talked about the flat tax thing. Pretty sure I came out on top of that one, so... I'll follow you to you, hoser. Follow you to you, hoser. Thanks. But my Discord's open. You just type !point Discord. I'm hoping that the link down below works still. But yeah, you could go eat. No problem. I'll probably still be here. I'll be here till... Thanks for the follow. I'll be here till 3? Is that enough time? Yeah. No, I'll be here till like 2:30. I have class at 3. I have class at 4. And it takes me 15 minutes to get there. And I have to still get ready. I don't even have... Oh, my gym clothes are on the ground. Fuck. Okay, well, yeah. 2:30. So, yeah.
Long wait times. You can go back to previous videos to look up the likelihood of you dying from cancers to terminal diseases. Compare the United States versus the other countries. Objective parameters. Objective litmus tests that you can use.
So you're saying that you die... Yeah, so another problem, right, is that, okay, you might be less likely to die from cancer in a United States hospital. But again, if you can't afford the care, then you're not getting the care, so now you're not a part of that statistic. So it's fudged. Because a bunch of people just aren't included in that statistic because they aren't there. Thoughts on modern economics? I'm pretty weak on modern economics. I would need a run through on exactly what you're trying to ask me about. Especially since, well, I live in Canada, so the Canadian economics is different than the United States economics. And I would just need more like detail, like what are you asking about? I think, but typically pretty weak on economics. I need more run-throughs. I need to do more stuff on it. I want to do more stuff about it, but it's hard to... Why the fuck? Oh, a nice misspelling there, Matt. Good job. I need to dig into it more, really. What do I have? Hold on. I have like a bunch of notes. Google Keep. What do I have notes on? Healthcare. Oh yeah, this stuff. Oh yeah. Right to vote. Yeah. So I want to dig more into stuff. I wanted to look up Canadians' wealth inequality. The fact that the top 20% of Canadians own about 67% of the wealth and the bottom 20% own none has been the subject of much attention and outrage. Found that stat. Yeah, if that's true, because I don't have a link for it, that's pretty fucked. And then Americans have much higher inequality. What I liked about our recent election, okay, cool. What I liked about our most recent election, now I would need to know, well, I would need to know how the rest of his policy worked, but Jagmeet Singh had the 1% wealth tax, which I believe if the way he implemented it was just like on, I think it was on anybody making over $10 million would be taxed 1% more. I'm pretty sure was all it was. Like, I like that. Like, we just need to tax our rich a little bit more. Okay, cool. Fraser Institute, April 2017. Cool, I'll keep this link in my... Whoops. I have a Google Keep with a bunch of shit in it. I'll just put it in there. Cool. Where did that go? Wealth inequality. Okay, cool. Share of wealth, 20% have 67%, bottom 20% have negative 0.4. Nice. You know what I want to talk about? I don't know if this was like, I found, I don't really want to say it much because I don't know what, I don't know, but, this savings, consumption, consumption line, and then you're not saving. You can't save, so the bottom, okay. Lifetime years, 65, so now you're not saving once you retire. You're saving in the middle, and you're not saving here. Okay. I think simply increasing tax won't do enough because after things get back to being more equal, the rich do other things to get the wealth back. I think there needs to be more equal systems implemented. Sure, perhaps, right? I would like to know what those systems are and stuff like that. Like it's hard to dig into, and it depends on a million different things. And I'm not in a Canadian election cycle, so I don't know what policies each person has. But like, it'd be interesting to dig into each policy. I've heard workplace democracy. Yeah, worker co-ops and stuff like that. Yeah, I'm for worker co-ops, but I'm not a socialist. I would consider myself a soc dem. So worker co-ops, great, but broad worker ownership of the means of production, no.
Use not do you like your healthcare? Well, I guess it's kind of free, so
because like, yeah.
I'll live in the crap hole.
But we could talk about it more in depth if you want, right? I have a Discord open, so if you want to ask me questions, you can just hop in there.
But a lot of money, by the way, the reason it's so expensive and it benefits the entire world is that a lot of this money is also reinvested into developing new drugs and medical technologies, which brings us to our next point that Bernie doesn't care about.
Americans pay more for prescription drugs than anywhere else in the world. Why?
Yes, because of lack of bargaining
Big
power.
Pharma.
We're getting ripped off by the drug companies.
So this point is pretty easy to go through. He's just gonna say that okay, Canadians pay more pay more in drugs, right? And we'll just let him run through the argument, and
Many
I'll
of
say
these
what it
drugs
boils
are
down to.
developed using government research and grants, yet are turned around and sold at sky-high prices to those who desperately need life-saving medication.
He's doing drugs.
We're going to stop this outrageous price gouging and cut the costs of prescription drugs for patients and hospitals by more than half.
How? Well, that's for the next video.
Yeah.
Okay.
At gunpoint.
Understood. So, simply,
Subscribe to
by the
my
way,
Patreon.
price fixing
Learn.
doesn't work. It wouldn't help things,
Right.
okay?
We're not talking about price fixing. It's called leverage. You have more leverage as the entire U.S. population than you do as individuals or smaller groups of individuals. Not workers getting full ownership, but giving the workers a few seats on the board would be fair. Yeah, well, I'm totally for worker co-ops, right? So you can have a company that's workers owning the means of productions. You can have individuals companies do that, and if those companies wish to elect one person to run the company, fair. If they all want to run the company, fair. If they want to have a board of people running the company, fair. I'm 100% for that. We have a bunch of them in Canada. I think Magna's one. Magna's a pretty big like factory plant in Canada, and I'm pretty sure they're a partial co-op. I think they have like I think they have a democratized board of directors. I think. Could be wrong on that one.
And this goes back again to the previous point that we made about the
worker
profits of the
co-ops.
industry. A huge chunk of that money goes into medical research, specifically drugs. Something else too. Keep in mind that drug prices soared under Barack Obama, and with the Affordable Care Act, commonly referred to as Obamacare, I refer to it as Affordable Care Act.
I wish I remembered why, but I'm pretty sure it was because like Medicare for All didn't actually give the proper leverage. It failed in a bunch of ways because of other reasons. Fuck, I wish I had the link for. I remember getting explained to me. I'm mad. That's okay. Also, capital gains in America get a lower tax than income. Yeah, but that could be. I need to dig into that one too because it's interesting. That one's definitely interesting to me. Is like how should you tax capital gains? Should there be tax? What kind of tax should it be? Harkdan in this video here was saying that there should be a flat tax on like stock exchange stuff, so that you get taxed when you buy a stock, not when you sell a stock. But it would make it seem like, okay, well, why the fuck would I buy a stock if I'm automatically losing 15% or even 1% on that stock? Why would I buy that stock if I'm automatically going to lose a stock and then it goes down even more? So now I'm fucked. Also, tons of countries love setting up tax havens for American companies, so billionaires are being left offshore. Yeah, but I think there's already a stock taxation on the sale of stocks. I'm not sure if I would need to figure out how that shit works. I would need to talk to some people or like ask some questions about how all that would work, because having a tax on the sale of stocks makes sense because you're already making money, so now you're getting taxed on the profits you've made. Yeah, well, I'm not sure if each transaction needs to be taxed, because I wouldn't buy stocks if the purchase was taxed. It'd be hard for me to justify buying a stock at $100. So let's say a stock is at $100 right now, and I buy that. Technically, I'm paying $115. Let's say the tax is $15 per transaction, 15% per transaction. I think that might be crazy, but let's just do that as a nice even number, as a nice number that we usually know how to use, because that's like a Canada sales tax 13%. We'll just make it 15. Okay, let's say it's 1% of each transaction. So if I buy a stock at $100, I'm actually paying $101. And then if the stock tanks, then I've lost that $1. That $1 is just gone to the government. I'm now losing money. It's hard for me to, you have to, when you're buying a stock at 1% tax, you have to already assume that you're going to make that 1% back. So when you're buying a stock, it's really hard to make money off that. You might, but it like your average return on investment with stocks is like 3%, right? So it's really hard for you to make that 1%. So if you're taxing that 1%, you're making it very, very difficult to make money. Now, if you just tax the sales, if you only tax the sales of stocks, that you're going to be selling stocks when you've made money on them, and then you're taking, so let's say you've made the 3%, now you're only making the 2%, right? So now your average is 2%, but that's still a profit. 5 to 6% nowadays. Okay, so let's say 5%. So you're only, because if you buy it and you're already losing that 1%, it's very hard to justify buying a stock, but it's easy to justify selling a stock if you've already made the 5%. So you've bought the stock for the normal price, you make the 5%, then you sell it at a 1% tax. That seems more fair to me on the face of it. I like that more. It's hard for me to justify buying a stock if I'm already going to lose 1% on it. All right. I'll continue watching this video. I'm going to add a couple stream markers so I can cut these parts out. Because it's not... Well, we'll see. I'll figure it out. I'll have to do some editing on the clip so I can post it on YouTube.
Just like I referred to as the Internal Revenue Service. I use full words.
Very nice.
So you're close to them.
I'm not going to be Cenk Uiguring this thing. I am going to make sure that I use all of the select.
I don't know why he doesn't know how to pronounce people's fucking names. Oh, is people just... Okay.
Ablas.
Good job. And the links.
Though, again, leftists, they love to claim that the drug prices continue to... No, actually, if you take the price inflation into account, this is one of the most controversial statements in President Trump's State of the Union address because it was accurate, taking into account the price of inflation. We've seen historic reductions in drug prices under President Donald Trump. Okay? Doesn't mean that it's perfect yet, but you do see that happening. And fixing prices is something a lot of people don't understand happen.
Here we links these fucking shit.
So again, leftists, they love to claim that the drug prices continue to... No, actually, if you take the price inflation into account, this is one of the most controversial statements in President Trump's State of the Union address because it was accurate, taking into account the price of inflation. We've seen historic reductions.
WhiteHouseGov.Senate.gov. Prescription drug prices are falling historic levels thanks to Trump administrative policies. So, is this the White House posting this? Because we know the White House is super fucking corrupt right now, and they'll do anything to make Trump look better. Higher drug price costs linked to Obama. Yeah, okay, this seems fucked. What's the link? Whitehouse.gov. Oh god. Senate.gov. Oh god. Even if the drugs are falling, they're still insanely high. Yeah, and we know how bartering works. We know why. Well, Steven Crowder doesn't believe that unions work. So the problem with talking to Steven Crowder, let's say, basically, is that he doesn't believe a lot of stuff that are true. So, for example, why unions work is because unions have bargaining power because they're a large group of people going to a single person and asking for higher wages. So the same reason why drug prices in Canada are so fucking cheap is because the Canadian government goes to a drug company and says, hey, we're not paying this amount, we're paying this amount. Drug company comes back saying, we can't afford to pay that. We can't afford to sell it to you to that amount. How about this amount? Canadian government goes, sure, that works. If you introduce private insurance companies, it fractures that leverage and makes it weaker. We know that. The reason why Obamacare, I'm pretty sure I'm remembering correctly, the reason why Obamacare didn't lower prices was because you had to pay more because of the fracturing. So they didn't have the leveraging power because the system was so fractured. So they had no leverage. Yeah, getting less shit on your food isn't, yeah. If the food's still shit, having less shit on it doesn't make it great. Oh, fuck, how do I link this? Whitehouse.gov. So, whitehouse.gov. This is not going to work. Senate. Is that Senate? Senate.gov. Nice.
And drug prices.
Fuck off. So.
Though again,
go away.
Drug prices continue to... No, actually, if you take the price inflation into account, this is one of the most controversial statements in President Trump's State of the Union address because it was accurate, taking into account the price of inflation. We've seen historic reductions.
So, comma, Senate Gov. This is not going to turn out to be anything. Why, what? My spelling's on. I feel like I'm sent. Oh yeah, there's an A there. Rip. So in other words, I'm never gonna find this link because it's just a super. Okay. Nice.
Reductions in drug.
These are always fucked because every time I open a link, if I can actually get the link, he'll never link it. Every time I open one of these links and I find it, the thing he has highlighted is taken super out of context, and like the next 3 sentences are a rebuttal to whatever he's linking. But it could also just be massive corruption because it's the fucking
historic reduction.
Senate. Increasing more slowly than general price inflation. In most recent period, drug prices have been decreased as of August 2019. Thus, CPRX has declined by 0.7% over the previous 12 months. Okay.
And drug prices under President Donald Trump. Okay? Doesn't mean that it's perfect yet, but you do see that happening. And fixing prices is something a lot of people don't understand when they talk about price gouging. They complain about price gouging. Okay, if you were to fix prices, let's say Hurricane Katrina. People complain about this. There's an emergency, so people are price gouging. What does that mean? A convenience store owner understands that there's scarcity, and so all of...
Okay, again. Again, these stats are fudged because even if there's a crisis like a hurricane, yes, the grocery stores might increase the price of bread in there by 300%, triple the price of bread. The government will still be handing out bread to people for free because you have a basic level of food care because we've declared food a human right.
All of a sudden, batteries, I don't know how much it is for a pack of AA batteries. What is it?
So same reason why with the coronavirus, those in Canada, they're M93 masks, M39 masks. Anyways, I think they're mostly because they're M3 and M something masks. The particle masks to stop the coronavirus, they either went completely out of stock or tripled in price because although the coronavirus isn't actually a threat to Canada, people think it is, so the companies increase their prices. If the coronavirus actually becomes a threat to Canada, guess what? Canada will ask a company to make a fuck ton of those, they'll pay them, and then distribute for free those masks to everyone. Part of the reason why a lot of the masks went out of stock in Canada is because the government was buying them and shipping them off to China to help them. Because we didn't need them because it wasn't a threat in Canada, and the Chinese population was getting their masks completely free because they needed them. So if for whatever reason batteries became necessary during a crisis, guess what? The United States government would most likely pool a bunch of money from a bunch of states, go out, buy a fuck ton of batteries, or a bunch of states or stores would pool in a bunch of batteries and send them to the people of said wherever the crisis is and give people batteries for free.
Few bucks, depends if you go double alkaline lithium, they keep going and going and going.
So yes, if you want batteries at a premium, because they're most likely not necessary, you have to buy them at a premium. Healthcare isn't the same because you need it. If something becomes necessary, we typically give it out subsidized or for free. Come on.
That Bunny and Duracell, I don't know. The ones that I think they're all the same. It's all big battery. I don't trust them. But the point is, the convenience store owner of the bodega says, well, now that's not $3. That's going to be $30.
Yeah.
People say, well, that's price gouging. Well, you know what happens if that person doesn't charge more in that instant?
Yeah, somebody will come and hoard all the batteries. Of course. But again, if batteries were all of a sudden necessary, the government would say, hey, batteries are necessary. We're going to figure out if anybody's hoarding batteries, we're going to pay those people for their batteries. We're going to take the batteries from the hoarders, distribute them evenly across the whole population so that we can help as many people as possible.
Someone walks in and goes, hey, I can't believe I have all these batteries that are only $3.
Same reason, if all of a sudden a hurricane smashes through Texas, a bunch of people who were living there, guess what? They will be taken, transported to a hotel or something, and live there for free at the expense of the government, because it turns out that we like to take care of people in distress. So, same reason that other countries have a single payer or nationalized healthcare service, is because we like to take care of people in distress. Same with refugees. Even though you hate refugees, we deal with people in distress. We help them for free. We don't just say, sucks, dude. Sorry your house just got blown the fuck up by a tornado. You have to spend 3 times as much for a generator, for fuel for your generator to fucking keep to keep you alive. You can do pre-prepping if you want. You can hedge your bets if you want. Like a lot of conservatives advocate you do. You can see this with advertisements from Ben Shapiro and stuff like that, who have the advertisements for the fucking, what's it called? Oh god, I forget what the company's called. But you basically buy the tubs of food that last you 3 years or whatever the fuck. Yes, you can hedge your bets and buy that, but most likely you're not going to need it. So therefore, you're just giving money to a company because you're scared that maybe one day something will happen. Sure, you can hedge your bets and hoard a bunch of stuff for a future problem that may or may not happen. And you might feel entitled that, hey, I'm not an idiot that this random, like, hey guys, I actually prepared for an alien invasion unlike you fucking retards, so you don't deserve anything. Like, no, what? Most people have empathy, or apathy? Empathy for other. I'm going to go with empathy. I'm not going to Google. Anyways, we actually care about other people, and when things happen unexpectedly, like a hurricane crashing through a state, we like to help people out. We don't say, oh, you didn't prepare for a hurricane during hurricane season? Get fucked, liberal. No, we help them out. We house them in free housing. We help rebuild their houses. We help people. Amazing concept. We don't tell them to get fucked because they didn't prepare properly for something nobody should be forced to prepare for, because we're not fucking jittery fucking maniacs like it seems like most conservatives are. You can watch people who are typically conservative. They have all this planning. Sure, you might be fine when such rare thing happens, but if it does happen, you should also want to help people. You want to help, right? You want to help people, correct? You don't want to just leave people to die. You want to actually help people. A way of helping people is letting them stay inside your home, maybe, if their home gets blown the fuck up by a hurricane, tornado, if it gets crumbled to the ground by an earthquake. You hopefully would want to help those people out. Why wouldn't you? Your neighbor's house gets an earthquake happens, your house somehow survives, your neighbor's house falls to the ground. Are you gonna tell them to get fucked because their house got fucked? Or are you gonna take them into your house and take care of them?
Hoard! That's what happens. And then you have to create more regulation that says, well, actually, we're going to guarantee that the price does not go up regardless of scarcity, regardless of supply and demand, but we are now going to be limited to 2 per customer. And then you have someone send in all of their family. And then they now all of a sudden they're hoarding even more batteries, and then they start selling them.
How? If one person takes enough batteries for their whole family, and then you limit it to 2 batteries per person, well, that person's hoarding the same. This is weird. He's not really getting into detail. He's just like, well, hoarding.
on the street and you create a black market. Anytime you try to fix a bureaucratic problem with more bureaucracy,
a black market. Where else could that exist? I wonder. Like,
I don't say anytime, but most of the time, it doesn't work that well. So going back to the drugs that have reduced in cost after Donald Trump, why do drugs cost so much too? We've talked about medical research. Let me put a...
So this is my favorite point that he brings up because it's always hilarious. Just the mindset you have to be in. It's just, it's like, okay.
The average cost right now to develop a single new drug is $2.6 billion.
Okay.
Now that sounds pretty bad.
That's a B.
Then take into account that the approval rate for drugs entering clinical development is less than 12%.
Sure.
So it requires the big evil monocled billionaires, they have to invest.
Wow.
Mm-hmm.
And there has to be some chance of recouping on their investment. Who would spend billions of dollars with a 12% chance of a drug being approved? By the way, the money that goes into research, that's the reason why the United States, you guessed it, leads the world in the creation of new drugs and medical research papers.
All right. This is all true. Now, why is it that your citizens pay the most amount of money for drugs? Why is it that drug costs way more than any other country? Well, it's because you guys don't have leveraging power against the drug companies. Now, if you want to argue that, hey, we, America, are the greatest country ever, we will help you guys out with all your... You know what? It sounds like I'll get through it, I guess. Americans, I guess, just have to bite the bullet and pay way more money for their drugs so that other countries can pay way less. We're just the greatest. We have to pay more. That's just the reality. We have to pay more. There's no other way around it. These other countries, they beat us to single payer, so they get to pay less in drugs, and we have to eat the cost because we're developing all the drugs, so we just have to eat the cost. Fine, you can say that. It's kind of immoral. But if you want to, like, if you're mad that we all beat you to single payer healthcare, so now you have to pay way more for drugs, okay. But don't you kind of sound like a third world country does when we ask them to regulate themselves for the environment? Doesn't this sound a lot like you when you're saying like, oh, well, we can't do anything about the environment because China's not doing anything about the environment? Well, yeah, but China's not doing anything about the environment because you won't do anything about the environment because China's still a developing country, even though their fucking GDP is crazy and they should be moving on to what they wanted to do, which was like the whole plan of going to socialism, blah blah. When will this show up? Probably never. But you're just mad that everyone else beat you to single payer, so now you have to pay crazy amounts of money for your drugs. Okay. So every other country will go on spending way less for drugs because we beat you to single payer. And you just have to bite the bullet. If that's your argument, then okay. Thank fuck I live in Canada, I guess. Yeah. No, yeah, I know, but because they're hopefully getting away from, they're hopefully moving towards more modern. They are actually beating the United States, but what I'm saying is that it's hard to, yeah, and that's good. I'm glad that they're taking steps, but you know how like a lot of people are saying that, so it's very difficult to get a third world country on board, like India, for example. India is another good example. It's hard to tell India to stop with their emissions without helping them out. So like when we go as the UN and say, hey, Nigeria, India, you guys have to you can't use coal. You can't use coal as a power source. Their response is, well, you guys used coal and that's why you guys are so powerful. So why do we have to stop and not get compensated for it? We have to compensate them to be able to do the stuff. We can't just tell them to be better because they won't, because we did the bad. So it's justified for other countries to get to our level to do the bad because we did it. So the only way for people, other countries to become green is if we subsidize them, because there's no reason for another country to agree to be us when we already did that thing. Yeah, exactly. Because if we don't, they're not they want to become a developed nation. And the fastest way to do that, as fast as possible, and the fastest way to do that is through fossil fuels. And the reason why, and we're in a privileged position where we can actually get off of fossil fuels because we are already a developed nation. But these developing nations need to get there. So we need to subsidize them to make them a developing nation through our wealth so that they don't have to, like, it's really hard to become a developed nation off of clean energy. It's really hard. It fucking destroys your GDP growth. Well, sure, but China and India are like the biggest emitters of global emissions, and they're technically developing nations. Sure, China's doing some stuff, but again, they're doing that because they're becoming more of a developed nation, so they're doing what we developed nations should be doing, which is moving to clean energy. And they're just doing it quicker. Like, they're doing it on the actual proper, like, trajectory that we should have done it. But we didn't. So other developing nations are like, we're not going to switch to clean energy because we can't afford it, which is true. Well, because they don't have... So an underdeveloped nation is a nation without healthcare, without... Like, there's a bunch of, like, checks. By chronic widespread poverty and less economic development than other nations. These countries have very low per capita income and many residents live in very poor conditions, including lacking access to education and healthcare. So if a nation doesn't have this, they're considered developing. China could move to be a developed nation. They're just choosing not to because they want their GDP to grow as fucking much as possible. Yeah, but you have to have... So they might have healthcare... They might have healthcare, but they might not have education. Or they might have healthcare and education, but they have shit living conditions and shit income. So if you have like most of these things, then you're considered a developing nation. And I know that China has shit income, China has shit living conditions, and I'm pretty sure China has poor education. I think their education is pretty good. Not sure about that, but they might have education and health. Let's assume they have education and healthcare. But they have poor living conditions and shit income, so they're still technically a developing nation because they don't have these things yet. They don't have good living conditions and high incomes. So they're on the tipping point of becoming a developed nation. All they need to do is pay their workers more and give them better living conditions, and then they're a developed nation, which they could do. They're just choosing not to because they want to boost their economy as much as possible. Yeah, it's very hard to go to these countries and say like, "Hey, we're gonna you can't use fossil fuels anymore because, well, we use fossil fuels to get to where we are." Other nations will be like, "Hey, well, we just want to get to where you are, so let us use fossil fuels until that point, and then we'll switch off." But then it turns out that you can't do that because we're gonna die before that happens. So you have to subsidize, and we have to distribute our wealth all over the globe to be able to get off of fossil fuels. And that's a fucking huge task to take on, especially since most modern nations anyways, or developed nations, don't even want to get off fossil fuels. The United States, for example. Canada's mostly off it. I think Ontario is running off of nuclear predominantly. I think we are running 52% of our power off nuclear. The rest is renewable energy. Which is great. I want nuclear. Nukes. Make the nuclears. Anyways, again, so back to the argument of the United States. If you want to, because this ties into this, because the United States seems to be, Stephen Crowder's just butthurt that he can't, that the drugs are so, that he has to front the cost. Because what's happening is that drug companies in the United States can't go to other nations. And in the UK, we're still big on fossil fuels because of the Tory government. Yeah. Yeah, and we have a pipeline going down because of the Liberals and the Conservatives. Although the pipeline is a weird discussion because it would help our GDP so much, but it's also it's also running through land disputes and a bunch of other shit. Like it's fucked. Is my shit fixed? Nope. It's really bad. All right. I'm gonna save right now. I just had this running in the background because I needed to grow. Where was I? So, what else we have? Yeah, so what's happening in the United States is that drug companies in the United States, they want to, like, let's say if everybody was on a privatized system, they might only sell their drugs for $400 a pop. Let's say, let's just pick a number. But because everybody else in the world is running a single payer system, they can only sell their drugs to every other nation at $100 a pop. So now drugs sold in the United States have to be sold for $300 a pop to compensate for the money they're missing on everything else. So United States citizens have to pay an extremely high amount for their drugs because everybody else already beat them. This is what the argument of Steven Crowder ends up being, it seems, is that every other country's already beat them to single payer, so now the United States has to pay more for their drugs. If that's your argument, okay, I live in Canada. I couldn't give a shit less. But how do you fix that problem? How do you fix that problem? Well, you have to introduce a single payer system and get a lot more leverage over those drug companies. It would be very difficult for you to do, it seems, but it's necessary if you want lower drug prices. Now, if you just want to, because Steven Crowder's argument is going to be, we just have to pay more. We just have to pay more. Sorry to break it to you. I have money, you don't. Bootstrap, pick yourself up. I have more money. Okay. I'm not going to be able to convert Steven Crowder over to single payer. But hopefully other people see that, hey, I can't afford that shit, so I'm going to try to push for single payer. I will pay slightly more in taxes so I don't have to pay. I'll pay $100 more in taxes so I don't have to pay $400 every month. I'll pay $100 more in taxes a month so I don't have to pay $400 a month on my insulin.
It's not even close.
I like leading.
They talk about this in the video. Germany doesn't spend as much on healthcare. Really? Germany doesn't? Well, I'm guessing that it's for very much the same reason that Canada doesn't spend that much on the military. You're well.
So yes, and then he'll move it on to military. Ah, yes, I forgot. We're waging this massive war against No, not aliens. Against not the Russians. Oh, Muslims in the Middle East. Right, we need... How much is the military budget in the United States at? $800 billion? Well, there's the military budget for 2019. $617 billion? You're right, we need that much money to fight against Muslims in the Middle East. True. I forgot how much war is... Yeah. Forgot how much we're getting fucking attacked. I forgot that the only reason Canada is still standing is because of the massive military-industrial complex of the United States. So again, if the whole purpose of the United States is to just defend the world and... like if Steven Crowder's argument is that the whole purpose of the United States is to develop drugs, defend the world, then okay, I live in Canada, so I will... Okay. If that's like, if the United States, the only way to survive in the United States is to brunt all these costs, fine, I guess. If you want to feel more macho about it, great. But it turns out that in my opinion, the military budget is completely unnecessary for the United States. So you could reduce that. If you think that you need that much, okay. I think you're wrong. United States almost tripling China's budget. So unless, of course, China's got some super soldiers, I think you're fine to cut this in half. Imagine cutting the military budget in the United States in half. In half! Where's Canada at? 22. Wow. $22 million. Yeah, mostly because we have a completely 100% volunteer army, and we don't want to fight people. Where's Russia? What, seriously? We're worried about Russia, and they spend less money than the UK. Wow, this is actually crazier than I thought. Holy shit. I thought Steven Crowder's argument would be like, well, if China and Russia team up, we're fucked. But if China and Russia team up, you're fine. you could cut this in half, and because 1, 2, 3, 4, 5. Fuck, I need to do math for this. But basically, NATO nations combined have more budget than China. Yeah, probably. But like, why is Russia's military so powerful if they spend so little? Why do you need to spend $750 billion? The answer is you don't need to spend that much money. You can cut that number in half and still be more powerful. If money means power, you could still be more powerful than China and Russia combined, the boogeymans of the world. Yeah, the second largest air force in the world is the U.S. Navy. Yeah, it's... Well, yeah, basically, like I was astonished. This is anecdotal, but I was astonished. A buddy of mine was in the military, Canadian military, and it was just like basic, like you just go through like basic level, just a private, right? You just go in, you do boot camp, and then you get thrown somewhere. And he was a gunner, so he was a gunnery. Or a gunner, so artillery. And in Canada, we train our gunners every position on the artillery piece. So the guy who runs the crank to aim it can also pull the pin. I mean, who can't? Pull the pin, load the round. What are the 4 positions? Pulling the pin, aiming the gun. I think there's 2 positions for swaying it and putting the better up. But anyways, basically, a person in Canada can run every position on an artillery piece. And when he was training in the United States, they were amazed. Completely flabbergasted that a Canadian soldier could do every position, and American soldiers only knew one position. They didn't know how to do any other position. First one, the system that is in place fucks the system. The DoD massively overpays for services and things that they purchase. U.S. pays $1,000 per bolt. China does not let private manufacturers rip them off. Money spent does not equal strength. Yeah, but what I'm saying is that Steven Crowder's argument is that money spent equals strength. Yeah. Because Steven Crowder's shit argument is that, oh, well, we can't afford Medicare because we need to spend $750 billion on the military. And we need to spend this much money because China spends less than half of that. And Russia also exists, guys, and they spend just as much as any other European nation. And then here's my country. And then here's any other country that they're actually at war with. Afghanistan, 12 million or 12 billion. It's not in our tax code to raise 10% of our GDP on military. What? Yeah. I gotta piss really badly. But I'll do that, and I leave it. I'm gonna be gone at 2:30, so I'll just wait. Yeah, like you could cut this number in half and be totally fine. The prices they pay are massively over what they should be paying because the current contract system makes these companies billions of dollars, which shouldn't. Yeah. You guys don't have proper leveraging for whatever. The United States government isn't leveraging properly against private companies for a multitude of reasons. Could be, well, the biggest argument is military-industrial complex, right? The population of the United States loves the military, so you get votes by increasing the military budget. Yeah, you see the budget get raised every single fucking year by any person in government, so. Yeah, so like, what's annoying is that the conservative argument always boils down to, oh, well, we can't afford healthcare because we pay for everyone else's military. Okay, but why? So why do you feel it's necessary to pay for everyone else's military? What are you defending against? What is the need for $750 billion? And I don't know. There's never an answer, really. It's like, oh, well, we need to defend ourselves against the Chinese that are definitely attacking us. Oh, wait, no, they're not. Okay, so Russia hates. Nope, wait, Russia's not attacking us. Also, they have nowhere near the budget. Okay. So we're defending ourselves against Iran. They have $19 billion. Afghanistan, right? Nope, up $12 billion. Just like healthcare corruption due to capitalism, free market. Well, it's not even like the free market is the reason it's failing. It's just that you guys don't have any leverage on the free market because you have extreme fracturing because you don't have a single payer healthcare system. So in Canada or in any other developed nation, you have the government go to a drug company and say, hey, do you want 30 million customers? Yes, we do want 30 million customers. Okay, we're going to negotiate a price. The drug company says, we want $400 for insulin. Canadian government goes, nope. You're going to sell it for this much. Company goes, we can't afford that. Canadian government goes, okay, this much. Then they agree, and it's over. In the United States, you have mega fracturing. So one company says, okay, I'm going to pay you $400. I'm going to pay you $410 per bottle. I'm going to pay you $350 per bottle, and then that way I can make $50 a bottle a pop, and then I'm going to sell it to my insurers for $400 because that way I'll make this much. Anyways, it's like you can't barter somebody's existence. Sure, but the size of the military is part of the corruption, no? Well, it could be, right? So yes, you could get better, like, because okay, I think maybe what you're saying, are you saying that like the size of the military could stay the same? This number would be smaller because you guys don't know how to barter properly? If so, then yeah, I could agree with that. I would still argue that the size of your military is way too fucking huge. But if you're of the mindset that you guys just don't know how to barter properly, and the corruption is causing you to spend more than what's actually needed to spend, then yes, I agree. Like if you think that the size of the military could be the same, but this number could be at 500 billion, then yeah, sure, I agree. Of course, like you guys just need to know how to barter better. So yeah, that makes sense. But I still agree that I would still argue that the United States military is way too fucking huge. Because there's no nobody in the world could even consider unless of course every single nation in the world attacked the United States. That would be, but even if that the United States would have to go so fucking bonkers to have that happen, that the United States citizens would also be like, fuck this, and then you would have no military. Yeah, so I agree with Devil Dog here to an extent, but I also would argue that the military of the United States is too massive. So yes, I agree that the United States is spending way too much money on equipment. That is true, 100% true. But I also would argue that the military is just way too fucking big. You don't need the 100 bases around Iran, or 200, whatever the fucking amount of bases they have around Iran. You don't need to be consistently well, the occupation in the Middle East is strange. It's being dealt with awkwardly, so there's some argument to have on that. But
and I say that as a Canadian, okay? People say, "Are you Canadian?" I was born in Detroit, raised in Montreal. It's not that hard to figure out. I could run for president.
So he admits it. I'm only bringing this up because at one point on one of his Changing My Minds, he told a person that he immigrated to the United States. He didn't. You already automatically were a citizen of the United States, so you didn't actually have to deal with an immigration to the United States. You didn't have to deal with it at all. You didn't have to pay fucking zero. You were already a citizen because you were born in Detroit. Oh no, yeah. I'm not saying drop it to Canadian side. I'm saying cut this in half. I'm saying that you can reduce the size of your military by 25%, 45%, and still be way ahead of anybody else. Let's say the price. Let's say let's be super generous. Let's say that negotiating a bunch of prices, you can drop this by like 25%. So this is now at like what it would be, $550 billion. You can then cut that $550 billion by half and still be ahead of China. So I'm not saying drop it all the way to Canada size, because we run a volunteer only military. We don't have a draft in Canada. We just run a volunteer military. We don't give a shit about military. I'm not saying that you don't need to give a shit about military and drop it to like the size of Canada. I'm just saying that you need to reduce it by a significant amount, because you are fucking way bigger. You have like, how many super carriers do you have? Don't you have like, you have 19 super carriers. Whereas China, our competitor, has 6. Not even. They don't even have 6. They're planning to get 6 by 2030. Do they have 1? Do they have 1? Yeah. No, I know, but if in a time of war, so let's say World War III starts tomorrow, Canada won't have a draft. It's in our constitution that we don't have a draft. It's only volunteer. In the United States, you guys would have a draft. All I'm saying is that this price, you don't need to, you can still be the world leader you can still be the global world leader in the military if you got rid of 9 super carriers. You'd still be the world leader in super carriers, because China has 1, I think, if I'm reading this correctly. I'm pretty sure they only have 1 aircraft carrier. China's first aircraft carrier. It was built in the 90s. Now, I know the military comprises a bunch of other stuff, but like aircraft carriers, super carriers are like the pinnacle of the military, I'm pretty sure. And you can look at Navy, because Navy is, what's the word for it? I'm pretty sure Navy is planned warfare. You have to plan for, like, a good Navy is a planned Navy, I'm pretty sure. Because you have to build the Navy out first to even use it. And it takes so fucking long to build stuff that if you lose a super carrier, you are crippled. Like, if China loses their 1 super carrier, they're fucked. Their Navy's fucked. It's over. The United States has 19 to go through. I don't think China's is a super carrier. They only have 1, but it turns into a... Oh, true. Forgot about that one. But yeah, like, I agree that you guys... You can have your military be the world's superpower, but it doesn't need to be this fucking huge. But yeah, I mostly agree with you, Devil Dog, that yes, you can like, yeah. I know spending could drop quite a bit if they gave a shit. But they don't, because people are making billions of dollars. Exactly, yeah. So I agree with you that the first step should be bargaining. You guys need to bargain correctly, not, oh, Boeing? Yep, here's $1 billion for a plane we are going to never use.
But I don't want to. All right, next clip.
You don't even want to know how much the United States wastes on processing paperwork.
Oh, will you tell us?
It adds up to hundreds of billions of dollars.
Oh, hundreds?
We're going to replace this Byzantine system of paperwork and billing with one single payer.
Oh,
That is not where the money should go on paper pushing.
Estimates show
like the Iowa
Medicare
app?
for All could save more than $500 billion each and every year on administrative costs.
Okay, this is true. This is a very true claim. Private insurance, with the insane regulations and government red tape that we've talked about, they have a lot of administrative expenses. Absolutely, that is true. But the estimates that the Sanders campaign they use, they're completely inaccurate. Why? Because you'd be expanding Medicare to everyone. To compare administrative expenses for Medicare currently as it exists, right? It's only for 65 and older. Yeah. Patients who are over 65, they spend
It's not even bargaining, it's corruption that their buddies running contests. Ringing contracts for their buddies and getting a kickback. Well, yeah, I know, but that means they're not bargaining, right? If you're just giving money away, you're not bargaining. That's what I'm saying. Like proper, real bargaining instead of corrupt. Here's money. Like if you're properly bargaining, you're not corrupt, is what I'm getting at. Yeah, pretty much. Crowder makes me want to injure myself most of the time. But I'm trying to come at stuff more calm instead of just like, because I know Crowder's wrong, but I'm going to try to rationalize what he's saying and what he thinks. So I know that, yeah, okay. Yeah, no problem, David Lug. I'm just trying to rationalize his position. So, well, not rationalize. I know it can't be rationalized, but I'm trying to get at what is his point and what does it mean, pretty much, right? So his point is that, okay, we have to front the costs of medical costs. We have to spend so much on medical costs because we're defending the world. Like, okay, well, what does defending the world mean? Do you need $750 billion to defend the world? What are you defending the world against? Seemingly nothing. And if you cut this budget in half, you still lead the world in spending. Why do you need $750 billion in spending? That's the true question. It's not about medical costs. It's about why the fuck do you need to spend $750 billion? And then the other one is, okay, you believe, and then like, so for whatever reason, Crowder's tying drug costs to military spending, and or he's mad that we all beat every other country in the world beat the United States to single payer. So now every other country gets to save on drug costs and the United States is to front the cost. So basically, in Crowder's mind, the United States is responsible for making all the drugs and defending the world. That is the United States' only purpose. And if you want to live here, you have to spend extra money because we are the protectors of the world and we are the drug producers of the world. Okay, so I'm going to live in Canada where I don't have to spend this amount of money because I don't give a shit about military and I don't give a shit about, and I don't think that you need to spend that much money to develop drugs or whatever. Like, you don't need it. You could bargain the prices lower. His point is thinking that, his point is thinking about things critically is bad, but easy to digest quips about lazy or dumb people. No, I know how Crowder's like channel works. I'm just trying to, so like if I want to understand it so that if I talk to somebody who's on the brink or a Crowder fan, I can explain to them like, hey, okay, so you think that the reason why the United States can't afford healthcare is because you need a massive military budget. Okay, well, why does your military budget need to be $750 billion? And then we could talk about that, and then hopefully you can explain to them like, hey, yeah, okay, or we can agree that, okay, yeah, we don't need to spend $750 billion. We can cut some stuff here, we can do some stuff here, we can negotiate better here, we can do all this stuff. American fighter pilots are given amphetamines. Drug costs affect the military. Yeah. Not even anti-Bernie. I think he has grand ideas. I just don't see how we can fund everything he wants to do. I think it's going about it all wrong way. Perhaps. Like, I would need to dig into a bunch of stuff. I could agree with you on a lot of stuff that, like, where do we get this money from? We would need to dig into that. We could dig into that together, right? Take one or two issues, fix it, and then move on. Stop trying to revamp the entire system in one go. We can't afford it. You should be able to afford it. So the question is, why can other nations afford this stuff, but the United States can't? And Crowder's answer is military, and we produce the drugs. Okay. Well, why does your military need to be that massive? And why do you spend that much on drugs? Crowder's answer for the drugs thing is, oh, well, other nations, his point boils down to, oh, other nations pay less for them, so we have to pay more for them. Okay, what that means is that because other countries beat the United States to Medicare for all, or a single-payer system, now we have to front a bigger cost. Oh, okay. So how do you solve that? Well, you get a single payer system and bargain with drug companies to lower prices. We can rewrite the tax codes so that companies like Amazon can't abuse the system and not pay your taxes. True. We can also just tax the billionaires with this wealth tax. True. That's not going to produce the $19 trillion on the low, and that's assuming that every single project goes as planned and the budget, which has never happened. Well, United States citizens already pay about 20-something trillion. Let's say right now we'll break dead even, okay? Right now, through private systems, United States citizens pay $19 trillion on medical costs. So if you just switch that to a single payer system, now everybody gets it. Everyone pays slightly less. Is the Medicare for All plan? Because right now, a smaller amount of people are paying $19 trillion, but you can change that so that a larger pool of people pay $19 trillion. Or maybe let's say we'll be charitable and say that a larger pool of people have to pay $25 trillion, which would require increases in taxes on different classes of people. Well, that's debatable. Of the 8 years thing, that's debatable. We can also give the IRS some teeth and researchers. We can actually audit the wealthy. This is just tackling Medicare alone, which I agree with you is probably doable. The entire Green New Deal is not. Perhaps we would need to dig in again. Like I'm leaving at 2:30, so we don't have a lot of time to dig into this. But I'd be glad to dig into this with you and stuff like that. So like we're just talking about Medicare for all right now. That's why I'm watching the video. But yeah, what I'm saying is that he's going about his fight the wrong way. Well, so my assumption is that Bernie Sanders is pushing the Overton window to the left. And then once he gets into office, we might end up with just something like single payer, is my assumption. Right? Like I don't believe that the extremes are going to happen. It'll be pushed back like government has worked for hundreds of years. That'll be pushed back to something more moderate. So you got to go with the extreme thing to push it back into something more moderate, which would be single payer, which is what Canada runs on. You might even be able to push it back to something more moderate, like what Germany runs on, which is a multi-payer system. What would be the right way? Well, there's a million answers to the right way. To tackle one issue at a time. So tackling one issue at a time could work and could not work. It's difficult. So because I'm pretty sure that's what Obamacare wanted to do, was just tackle one issue, and it failed because they only targeted their extreme plan was a moderate plan to Bernie Sanders. So their extreme plan got pushed back to like a semi-moderate plan, Obamacare, and it failed because it didn't have proper leverage over drug companies. Bernie Sanders has literally been the same for 40 years, lower US military budget in favor of healthcare and so on. I'm not arguing that we can't just fund just healthcare, yeah. I know, but this is what we're talking about. Wow, that's what I'm talking about. I'm not sure if Thick Zeke is talking about a bunch of that stuff, but I'm talking about just healthcare. I'm not even really talking about just funding healthcare. I'm trying to get to the crux of why does this number need to exist, and why do you guys need to pay extreme amounts for drug prices? And Crowder's argument is, well, military. We need to defend the world against what? I don't know, but we need to defend the world, so we need to dig into that. And then the other argument is that, oh, well, other countries are buying the drugs for cheaper, so we have to front the rest of the cost. And we need to like dig into that, because that's like what, like if I talk to if I can, the way I believe that I can dive into and not crack, but like convert a Steven Crowder supporter is explaining to him like, okay, share a link to what? Oh, can you share? Yeah, you can share any link you want. The way I think I can get through and crack and convert a Steven Crowder supporter is explaining to him like, hey, we don't need to spend this much fucking money on the military, and it turns out that you can actually pay less for drugs. I'm saying we can't fund free healthcare, free college, high-speed internet for every American, getting off the fossil fuels all in 10 years, which is not possible. Yeah, I'm not arguing that you can do that. I'm talking about healthcare right now. So I'm watching this video because he's talking about Medicare for all propaganda. So I'm not talking about the Green New Deal right now. Yeah, I'll watch this later because I don't have that much time. I need to get through the rest of this video. But yeah, I'm agreeing with you, Devil Dog. You could tackle these things differently, and my whole argument is like, because Steven Crowder's argument is that, oh, we can't afford healthcare because military, and we can't afford healthcare because we have to front the cost of drugs. Yeah, okay, cool. I think Devil Dog, I think we are in agreement. I think we're good. I'm gonna continue watching another video. Well, we could dive in. Okay. okay, perfect. I'll just watch the rest of the video.
More.
We could talk about. Fuck. Can I do it tonight? I could probably do it tonight. So I'm done. Oof. I'll be back here at like 10 p.m. Eastern time because I'm going to the gym after my class, and I'm done class at 8. So 2 hours at the gym, 10 p.m. I'll be back around 11 p.m. If you guys are here at 11 p.m., I can run through this with you guys because I'll have basically unlimited time. But I have to leave in like 27 minutes.
Overall on healthcare, so the administrative costs will of course be a much smaller percentage.
Thanks for the follow, buddy. I appreciate it.
Also, something else that's important to note. The
I'm also getting
administrative
swass
spending
right now,
can actually lower all kinds of other costs and spendings within a healthcare, a health insurance company. It's just like here, we have to spend a whole lot on updating the studio, making sure that the insulation is not flammable, making sure that we don't have rats chewing on the wires in the attic, making a much smaller percentage. Because you'd be expanding Medicare to everyone. To compare administrative expenses for Medicare currently as it exists, right, it's only for 65 and older.
Yeah.
Patients who are over 65, they spend far more overall on healthcare, so the administrative costs will of course be a much smaller percentage. Also, something else that's important to note. The administrative spending can actually lower all kinds of other costs and spendings within a healthcare, a health insurance company. It's just like here, we have to spend a whole lot on updating the studio, making sure that the insulation is not flammable, making sure that we don't have rats chewing on the wires in the attic, making sure that we have equipment here that can cost many hundreds of thousands of dollars annually that doesn't go directly into the pockets of employees because it allows us to work more efficiently, more effectively, and employ more people in the long run. So to look at it through this myopic, it makes me very sad, but also angry. I'm really angry because then I realize I'm sad when I think of how much a company has to spend in administrative costs, and then I'm angry when I realize that the proposed solution to less paperwork is the federal government. Just consider.
Yeah, okay. That's what I thought. I was like, where's this argument going to boil down to? And it just boils down to federal government bad at doing paperwork. Which, to a conservative, is, of course, federal government bad. They don't do anything good. So that it would have to dip into a whole other argument of like, okay, well, why is the federal government bad at stuff? Is the federal government actually bad at stuff? Or are they underfunded? And they're underfunded because conservatives are cutting funding so that later they can actually just delete the whole thing. So this is a typical conservative thing, is that you cut a program's funding so that the program does worse, and then during the next election cycle you go, look at these fucking liberals, what they did to this. They ruined healthcare because it doesn't work. The healthcare system doesn't work, even though we cut it, but the healthcare system doesn't work. In my next term I will destroy it, I'll get rid of it, and all this money will go back into your pockets, is the typical thing. But that's a whole fucking other topic.
Number of pages for government bills ever. The Affordable Care Act was 10,000 pages, and according to Washington Post,
just one copy.
That's not too long because, frankly, this is to be expected in any large and complex governmental undertaking. Yeah, taking over a fifth of the American economy could be considered sizable. And by the way, we're also talking about, while we're talking about big evil corporations, I understand the problem with transparency. I believe that the government should absolutely ensure that companies, corporations...
Fuck, man, I gotta piss. Okay, I'm gonna be back really quick because I can't actually concentrate with how much I need to piss right now. So, fuck. Alright, sorry about that. My piss was just backed up all the way into my brain, so...
trouble. They don't lie what's on there. They don't lie on the label. They don't lie to people as far as their business practices. I'm supportive of transparency, just like I'm supportive of the military, because I believe that's a legitimate role of government.
Yes.
That falls under the purview of government to make sure that consumers are not being lied to when they make their decisions. While we're talking about transparency, hey, we signed a health care bill that took over a fifth of the economy that, admittedly, from Nancy Pelosi, they had to sign to know what was in it. Compare that to the liability that a company faces. The reason they have to pay so much on administrative costs is because they don't get to, I don't know, or am I covered? I don't know about your copay. I'm going to sign and see what happens. Let me put this insulin needle in your lower abdomen and hope for the best.
Wait, what?
That to the liability that a company faces. The reason they have to pay so much on administrative costs is because they don't get to, I don't know, or am I covered? I don't know.
You're right. The government just gets to do that. Oh, yeah. No, you dumb bitch. Under a single payer system, the companies, like in Canada, the RVH, the hospital near me, is a private entity funded by public money. So they still have that liability. You can still sue the fuck out of RVH if they fuck you up. There's still that liability because it's not nationalized. It's single payer.
I don't know about your copay. I'm going to sign and see what happens. Let me put this insulin needle in your lower abdomen and hope for the best. They don't get to do it. For context, when people talk about big, evil, corrupt corporations, and I agree, there are some. Absolutely, of course. I'm not saying that all of them are angels, but why do leftists, why do progressives, why does Bernie assume that everyone in the government is inherently altruistic? For context, Bernie Sanders of Vermont, Senator Bernie Sanders of Burlington, Vermont, is less beholden to insider trading laws than Jeff Bezos. It doesn't apply here.
What?
And this is important to go back to. Bernie, he did a whole video on here about how he'd pay for a $34 trillion a decade plan without explaining any real way that he would come up with this money. That's because we know.
Well, besides this, but that's okay.
The answer would be taxing everyone. Sorry, only if you make over $29,000 a year. I know that doesn't.
Well, it's the same system as this. So it's literally the same tax bracket up until $250,000. Where the fuck is that? Or is it 300? Yeah. Oh. Same. Oh no, yeah, sorry. It's up to $500,000. Same exact tax bracket up until making $500,000.
Rich people, the struggling middle class. That's why Donald Trump's a prick. But everyone making over $29,000 a year in their household, they would have to be taxed at significantly higher rates. And we have to look at a comparison because these numbers don't exist in a vacuum. Look at how things went under Barack Obama. Premiums went up, deductibles went up, drug prices went up, and with Donald Trump, he hasn't gotten a whole lot done.
Yeah, but because the Obamacare, the Affordable Care Act, had improper leveraging. Because it wasn't funded enough and didn't have enough people under it. The Affordable Care Act didn't have enough people under it to properly leverage, so it had to pay the government had to subsidize itself, I think, or like whatever. Anyways,
I will admit that, but at least we've
because it was too small. It's the same thing. It's the same thing because this is the classic conservative point, right? Where the cost to run public schooling in, let's say the cost of running public schools in a country is $10 million. You need $10 million to fund public schooling. A conservative government will come in and say, hey, their plan will be, hey, we're gonna cut taxes and give you more money in your pocket so that you can spend more money. Sounds good. Sounds great. It's very simplistic. Good message. Gets to the point. Gets votes. So, but those tax cuts cut the education budget by $1 million when they need $10 million. So it was before running at $10 million. Now it's running at $9 million when it needs $10 million. So now the education system is broken. It doesn't work anymore. There's not enough funding, so it's broken. It doesn't work. That conservative government while saying before that the education system is dumb by like propaganda and stuff like that, then reduces the funding to schools. So then the system's actually broken. And then on their second term, they say, look at this broken education system that the liberal government or whatever, the opposing government gave us. Look at this shit system they gave us. In my next term, I'm gonna privatize the entire education system and put more money in your pocket, and you get to choose what school your kid gets to go to, and you can make the choice because the government can't make it. Clearly, the government can't make it. Okay, well now the entire education system is gone just because they cut the funding by a little bit. So same thing with Obamacare. It couldn't function because the leveraging power wasn't there and the funding wasn't there. Conservative governments over progressive changed my mind. Well, I have 15 minutes, so if you hit follow, we can talk about that when I get back at 11 p.m. Eastern time. Okay. You can join my Discord, and we'll have a nice conversation about that. But I gotta get through this video in 15 minutes.
Prices go down when you account for inflation. Yeah. But I have to go back. Before we end this, we're talking about Canada. This bothers me so much. People talk about the world, and they talk about, how much less they pay in healthcare. Really? Places like Iceland, Denmark, Sweden. Yeah, you can because of the Allies. You can because we just...
See, exactly. So his argument boils down to, we are big macho man America, and every other country gets to live in peace because we have to defend them. We have to brunt this cost because we are the heroes of the world. Without us, the world would fall to ruin. Without our military defending the Icelandics and the Norwegians against what? Sorry, you're asking what are we defending against? The Muslims. The Muslims would invade everyone if we weren't defending them.
We were fed up when a couple of guys decided to take out some boats.
Yeah.
Then we showed up and said, all right, I had to come back there.
Knock this off.
Canada is a great example.
So the joke, I guess his point was, remember when, yes, I forgot. Steven Crowder and types like them believe 100% that the United States was the only reason that World War I and World War II, we won World War I and World War II. Steven Crowder believes 100% that the United States won World War II, completely ignoring what the Soviets did. Like the Soviets lost millions of people, like 500,000 people died in like one battle of a ball. Like people died in crazy numbers in the Soviet Union. But Crowder will completely ignore that just so that he could push this agenda that, the United States is just the best, even though that's not what happened. So this is the problem with all these videos, is the amount of like you have to jump through a bunch of loops and you have to say a bunch of stuff that's not true just to get to this conclusion. So his answer for the reason why the United States can't afford Medicare is because we won World War II. The Soviets were nothing more than war criminals. They were war criminals. They also invaded the Germans and absolutely fucking annihilated them after the Battle of Stalingrad. That's why the war ended. Because the Soviets fucking pile drive through them. And then there's another historical argument that the only reason... So apparently, what happened with the Japanese is that the Japanese were... So the Soviets declared war on Japan, and then a couple hours later, the nukes were dropped on them. So there's a strong argument that the only reason why the Japanese actually surrendered was not because of the nukes, but because they didn't want to get taken over by the war criminal Joseph Stalin. They're like, fuck it, I'd rather be a United States colony than captured by the Soviets. The nukes didn't have much to do with it. That's a strong argument. But it's okay. No, that's not what happened. The Soviets were on their way storming Berlin. The United States landed in France and were like, okay, we're not going to beat them to Berlin, so we're not going to try to save on manpower. Which is totally fair. Totally fair. 100% totally fair by the United States to not push on Berlin because it would be a complete waste of manpower. Why not let the Russians kill themselves? Totally fair. But The United States didn't win World War II. It didn't happen. It was a joint effort by all nations. And also, there's huge arguments that the Germans couldn't win anyways. It was impossible for the Axis to win because of resources.
My entire life, Canada going, oh, we don't have to pay this much for our drugs. Yeah, you're welcome. You're not the ones creating the drugs and the medical technology.
See, there's the other point, like I was talking about before. Because the United States makes the drugs, they have to pay more. But why? Why do you have to pay more? Why? Why are you allowing drug companies to fuck you in the ass? Is it just because big macho man? Okay.
From which the entire world benefits. You want to know how you can actually gauge...
Right? So, like, this is exactly what I was talking about before. His argument boils down to, we are just the shining white knight. We have to take on these costs so that the rest of the world can live a better life. Okay. Fine. All right, I believe that's immoral, but if you are okay with the United States living in shittier conditions just so that you could be the guardian angels of the world, even though you don't really need to be, there's no big threat looming, and drug prices could be cheaper. Okay.
That the United States benefits everybody in the world, unlike empires to have come before it. This idea that the United States is an evil empire. Okay, imagine any other empire ever in the history of mankind. Okay, take your pick. You want to go with the Greeks? You want to go with the Romans? You want to go with the Ottomans? Let's go with Rome. Picture Rome. Only instead of a little place, what you're talking about in Rome, give Rome the landmass of the United States, okay, not to mention the military, the purchasing power, the GDP, and Rome, for some odd reason, has the second largest country as far as landmass to the north of it, outside of China, but I think it's at least close, the lowest population per capita, some of the highest concentration of rich, vast, natural resources with no way to defend it, and Rome says, oh, you know what? We're going to engage in free trade with them and let them benefit from our modern medical innovation. We're going to...
So yes, his argument is literally, this is charity. The United States is a charity. We're going to give you the drug. Canada, you're not negotiating with us. We're giving you these drugs cheaply, for free. We're giving this to you because we're just so nice. We could give this to our citizens, but instead, we're giving it to you because we love you so much.
Give Canada plumbing. I don't know what kind of medicine they had, but I think they had plumbing, and that was pretty cool back then. So
we also invented the drug that saved the war. The stuff that makes you hurt less. Yeah, okay.
It's never happened before. Yeah, you guys don't have to pay for your military because we foot the bill. You can look at NATO. We did a video on that. But if you want to brag about how low your healthcare costs are because your government decides to subsidize American medical innovation.
No, we don't subsidize. We bargain. We don't subsidize. We bargain.
Well, this is just my opinion. I think we should shut that tap off and see how you like it. And Canada, you know what? You're going to have to start buying...
So that would be extremely immoral. You could do that.
Some more tugboats and...
I don't know anything about how the U.S. destroyed the Nazis, not the Soviets, which were one of the causes because World War II started in the first place. Wait, what? Of the causes because World War II started in the first place, the U.S. had an agreement with the Soviets to let them take Berlin. Did you know that Germany and the Soviets had a pact? The Molotov-Rabona Pact? Is that your argument as to why World War II started was because of that? Because then the Germans said, fuck that deal, and invaded them. Yeah. But then the Germans said, oh, I'm going to invade Russia because I'm the big dumb. And then Russia said, oh, Hitler wouldn't attack. No, that's not true at all. Hitler wouldn't attack Poland because Russia wanted half of it. So if Hitler invaded Poland, Russia would have invaded them. That's how the Molotov-Rabona Pact worked. The reason why Hitler wanted the Molotov-Rabona Pact was so that Hitler wouldn't get invaded by Russia. and Russia didn't want to go to war because they were becoming a developing nation. Come on. This is very simple. The same reason why Chamberlain gave Czechoslovakia to the Russians, or let it happen, was because nobody wanted to go to war, because 20 years ago, World War I happened. People were like, fuck war. I don't want to do it. I don't want to have war. People were signing deals left and right. But the Nazis wanted world domination. So they invaded France, and then they invaded the Soviets, and the Soviets said, that's fucking stupid, and crushed them. It was the Polish defense. What? It is the Polish defense was to go on the eastern side of Poland and wait for help. What? So you're saying that the Polish went to Russia to defend their nation from attackers on the west side. Now, I'm no genius about tactics, but giving your nation away to defend yourself is not smart.
And propeller planes, because you no longer have the luxury of being protected by our Marines, by our Navy, and our Air Force.
What are you protecting us against? What is trying to invade Canada?
Also, we're not giving you any more penicillin. Piss off.
Penicillin. That's the thing we invented.
Hey, if you enjoyed this video, subscribe or hit the notification bell, because that lets your mobile.
All right, Corvo, if you come back at 11 p.m. Eastern time and you want to hop on Discord, that'd be great. We can have a nice discussion about this, but you just don't understand. You have a big gap in history that you're missing out on. But if you would hit that follow button, we can talk about this. We can bring stuff up about the war. And then what was the other thing we were going to talk about? Anyways, we'll talk about, and if you guys come back at 11 p.m. Eastern time, we could talk about this stuff. But I'll put Corvo at the top of the list for talking to, because it seems that we disagree on a lot of stuff. Read some books. How about I just go get a history? How about I go get taught history from a professor? Oh wait, I did that. Oh. Their plan was to defend on the river. Which river? Who is paying you to attack U.S. politics? Nobody, actually. I'm doing this for free right now. I don't have a sub button. I don't know anything. If I was I would be in a way better accommodation than my basement if I was being paid by somebody. But again, we'll come back 11 p.m. Be here. Join my Discord, please, so we can talk about this voice to voice instead of over text, because it's very difficult to bounce ideas back and forth when I'm reading your text, because there's a bunch of people talking. Pursue the river and wait for France and England to invade, something they didn't do since the Soviets took the other part of Poland and Nazis cold concentrate. Wait, what? You know that the Nazis invaded France way after. The reason that... So, Poland wasn't defended because nobody wanted to go to war. Because World War I just happened. People were still rebuilding their nations. So, Poland was invaded in 1939, and France was invaded in 41. No. Poland was invaded, then Czechoslovakia was taken over, then France was declared on. May 10th, 1940, invasion of France. Invasion of Poland. September 1st, 1939. Yep, Poland, September 39. And then And then they had, so Poland was invaded. Then they had the, or was it Czechoslovakia that was rotated? There's the peacetime, I forget what they called. So 39 happened. March 39. So September. And then March. Okay, so Czechoslovakia happened first. So my bad on that one. Czechoslovakia happened first. Yes, okay, so there's the peacetime. Okay, yeah. So there's the peacetime. So Czechoslovakia happened, then peacetime, then Poland, then France. Yeah. Yes, but a year after. Poland got invaded in 39, then France got invaded in 40. Like a whole 6 to 7 months after. Still time. It's not like Poland was invaded, then France invaded right after. Poland got invaded. There was a peacetime where people were like, what the fuck's going on? And then France got invaded in 40. Poland invaded in September of 39. And then in May, France was invaded. It's a lot of time. No. If you want to consider maybe some small skirmishes or some talks, war, okay. But Poland was taken over and there was no official war until 40 when France was invaded. World War II started with the invasion of France. You can declare war on somebody and not go to war with them. That's why, because Poland got fucking annihilated, and they're like, oh shit, do we want to do this? And then 6 months later, Germany invaded. Yeah, some people would consider the invasion of Poland the start of World War II, but that's after. That's us looking back at it. So okay, this is what you're getting a misunderstanding. Let's imagine you are in the year. Let's imagine you're in the 19th. You're just before the war starting. You are around in the years of 1935 up until 1945 when the war's over. This is where you are. So to us right now in the modern era, we would say that the war started when Poland was invaded, because that's what pretty much kicked it off. France wouldn't have gotten invaded if Poland wasn't invaded, and blah, blah, blah. Some people might actually say that the war started the moment Czechoslovakia was taken. Because Czechoslovakia was supposed to be peacefully done, but then they invaded the rest of Slovakia. So they were just supposed to take Czechoslovakia, but then Germany invaded Slovakia. So some people might say that's when they started the war. Some people might say that the war started when Germany took Austria in the Anschluss. Oh, okay, yeah. So you're considering the Tsar invasion the start of the war. Most people wouldn't. That's what I'm getting at. No, okay. You're missing how history goes. This is all debate. This is so the same reason why people debate why the war ended. Some people would say the war ended the moment the nukes were dropped on Japan. Some would argue that the war actually ended when the Soviet Union declared war on Germany, on Japan. And then some would say that the war ended after the nukes were dropped when the treaty was signed. Same thing with the start of the war. Some people would say that the war started when Czechoslovakia was invaded. No, but this is all debate because no one actually knows because it's history and nobody, like you could say that it started when France invaded Germany. But if nothing happened there because the Saar offensive stalled, and if Germany didn't want to go, if Germany only wanted Poland, then the war wouldn't have continued. And if Germany didn't sign a Rabona Pact with Stalin, then the war would have never started because they would have got invaded by Russia and got decked because Germany's tech at the time wasn't all that great. So this is why it's all debated. The start of the war is muddled. Okay, so you can either have it at the start of when Poland was invaded, you can have it when France was invaded, you can have it when Czechoslovakia was taken over. It is debated. Oh God. I've never, just because you haven't heard something that doesn't mean it didn't happen. Sorry to break it to you, buddy. NA education. True, dude. True, guys. True. It's very hard to decipher when a war started. The U.S. fought 2 separate wars, Pacific and Europe. Yeah, so we could say that about Canada. Canada was on the Eastern Front in Germany, or you can consider it the Western Front, depending on the. And we were also out west in Japan for some of the invasions. We helped you guys get the Japanese off of Alaska. There were some invasions of Japan in Alaska. We helped you guys take back Alaska. Canada was awesome. War didn't start when the Declaration of War was sended. Yeah, that's why it's debated, my guy. Because, of course. The greatest generation saved the world. Nice boomer take. War didn't start... No, I know, but the Declaration... Oh, my God. But, so you could consider... Because the United States didn't join the war. You could argue, although it would be stupid, that the war never started until the United States joined it. Right? Or you could argue that the war never started until Germany invaded France, because at that point, it was just France against Germany. It wasn't... Because... Britain didn't send troops for the Saar offensive. It was only France. France was doing the Saar offensive. They got held up. Then the British sent troops to France to defend the Maginot Line once the Saar offensive got stagnant. And then Germany invaded everybody, which was in 1940. Yeah, but England didn't send troops to help Poland. They only sent troops to defend the Maginot Line after the Saar offensive stalled. That's why the start of the war is debated. They're all very similar times. But you can't hammer it down to one thing. You can't say, oh, Poland. Also, your argument is that the Russians started the war because they signed the Rabona Pact. Isn't that your argument? That, oh, it's Russia's fault. Which then you can just reduce that to, oh, it's Chamberlain's fault for trying to sign a peace treaty with Germany for Czechoslovakia. It was the Nazis and Soviets' fault. So Chamberlain did nothing wrong? Chamberlain was completely justified in giving away Czechoslovakia? It wasn't his fault? That didn't add anything to the war? The United States didn't do anything wrong by not intervening? Because if the United States intervened early, maybe the Germans would never have done anything. What? Yes. No. Are you dumb? What? No, I know, but the reason they weren't allied with Poland was because the United States didn't want to deal with any wars. But what would have happened if the United States was allied with Poland? You're trying to blame not the Soviets for the war. But you could easily blame Chamberlain for dealing with the Czechoslovakia thing completely incorrectly. And you can blame the United States for not being a part of this at all and being isolationist as fuck. Yes, because it was viable. Because both of them are bad. Yes, but that doesn't mean... Oh, no. Poland was going to get invaded by Germany if Russia said yes to the Rabona Pact or not. If Russia said no to the Rabona Pact, they wouldn't have got any land from Poland, and Germany would have a fuck ton of land. And then Germany would have invaded Russia and got smoked anyways, because they didn't understand how powerful Russia was. Russia needed to buy time to increase the size of their nation, to increase their GDP, to increase their economy, do all this stuff, build up their nation. So they signed the Rabona Pact because they thought that Germany wouldn't say no. Yes, we know that. We know Stalin was dumb, but Germany was also dumb when they broke the Molotov-Rabona Pact. And Chamberlain was dumb when he decided to let Czechoslovakia get taken over by fucking Germany. That's what I'm saying, why it's debated. And the United States was dumb for not intervening in any of this until way later. Yes. Same thing with Russia, which is why they signed the Molotov-Rabona Pact, because they didn't want to deal with the amount of losses they would have had, even though they probably would have won anyways. And the same reason why Chamberlain went and said, Germany, you can have Czechoslovakia, because nobody was prepared for war. How was the start of World War II debated? Because Stalin and Hitler were dumb? Everyone was dumb. That's why it's debated. Because you can blame it on Chamberlain for letting Germany take over Czechoslovakia, giving them a fuck ton of resources and manpower. You can blame it on the USA for not intervening earlier. And you can blame it on Russia for signing the Rabona Pact. No, I know. But by proxy, they allowed it to happen. Instead of defending all of Czechoslovakia, they said, yeah, you can take you can take the Czech Republic and just don't invade Slovakia. And then they invaded Slovakia. And then Chamberlain was taken out of office. Yes, they took the Stout land, and then they took the rest of Czech, and then they took the rest of Slovakia because Chamberlain gave blind faith to Hitler. Because Chamberlain was a fucking dumbass. And then you can also push that blame on the United States for sitting there and being, Why didn't Canada intervene? Canada was intervening with the UK. Whatever the UK did, I don't know if you remember this. Canada is called a colony, so we did whatever the UK did. That's just easy. We might have had our opinions. Didn't matter because we're a colony. Can we blame Canada? You probably can, because we didn't push hard enough for Chamberlain to not do something. You can blame Canada for something if you want. It's hard because we were a colony. We don't really have much power. But maybe we didn't tell Chamberlain that he's a fucking moron hard enough. Maybe that's what happened. I gotta put socks on. It's really hard to blame Canada, but because Chamberlain's choice was almost all his. Where's my socks? This. Thank you. Fucking okay. UK was getting their asses kicked. Well, yeah, that's why Chamberlain thought he could make a peace treaty, but he failed. If you can, well, actually, France had a better military. They had horrible planning because they're dumb. No, you're wrong. That's just wrong. France's military, based on technology, was stronger than the Germans, but France had horrible fucking tactics. And the UK only put troops on the Belgian border because they thought, and also they didn't protect the forest that Germany just invaded through and cut them in half. That's what horrible fucking tactics is the reason why the UK and France lost. Not because their militaries were much worse. Now, if you want to say that, militaries is just tactics, then, well, you're wrong, but okay. That's also not true. America, did you know the Great Depression affected everyone? When Czechoslovakia was being partitioned, basically Poland took a small region from it, so France sanctioned them and didn't. Wait, what? When Czechoslovakia was being partitioned, basically Poland took a small region from it, so France sanctioned them and didn't allow them to mobilize when Germany was putting troops on their border, not to provoke Germany. Okay. We had to rebuild our military overnight to save you. Okay, you guys are just completely... You guys have no idea what the Soviets did in the war. Yes, the Soviets were shitty, fucking, horrible people. But it's undeniable that their war machine was fucking disgustingly powerful. And the major reason why the Germans surrendered was because the Soviets were fucking pile driving them. No, you're wrong, because that happened. The Battle of Stalingrad was Germany versus the Soviets alone. Then they lost the Battle of Stalingrad. Then Normandy happened. Now, they happened very close to each other. But that's what happened. Battle of Stalingrad in 42. So, Battle of Stalingrad happened in 1942, and the Normandy invasion happened in 1944. That's 2 years apart. No, Germany was not fighting two fronts during the invasion of Stalingrad. The invasion of Stalingrad was Germany versus the Soviet Union, clashing heads, full force. Because the invasion of... Now, if you want to say that, oh, well, a fuck ton of resources were put towards Berlin, were put on the UK, you're dead wrong. The Air Force was attacking Britain a lot, a fuck ton. But the bulk of the German army was in Russia for the Battle of Stalingrad, and the bulk of the Russian army was in Stalingrad. The rest of the Russian army was over near Japan to defend the borders over there, because they can't let those go. And then a small amount of the German army was at Normandy to defend or to attack the British. Because the United States wasn't in the war at this point. They were thinking about it. Some U-boats were attacking ships, and Pearl Harbor hadn't happened yet. So Germany was just throwing planes at the British, and Stalingrad was happening. Stalingrad happened. Germany lost big time at Stalingrad, and then Russia started invading the fuck out of them, and then D-Day happened. Yes, but this is why it was a joint effort. The United States didn't solely win the war. Russia didn't solely win the war. It was a joint effort. Without the U.S., they wouldn't have shit. That's just not true. I'm assuming you say wouldn't win the war alone. There's a lot of historians that would disagree with you, because the Germans had shortages up their ass. That's why the Battle of Stalingrad happened, because the Germans had no fucking oil. So they needed to invade the Caucasus, and when they failed at the Battle of Stalingrad, the war was over. And that doesn't happen if the Soviet Union doesn't exist. It was a joint effort. The United States definitely helped a fuck ton. The U.S. tanks were destroying the Germans. Also, the Germans lost the air superiority because of America. No, I'll allow that message. Hold on. Because they got blocked by the bot for some reason. The what actually happened, for most historians, the UK bombed Berlin, which pissed off Hitler, and then Hitler started bombing London, which was the Blitz, the London Blitz. The London Blitz allowed the Royal Air Force to rebuild themselves, and they took back air superiority. That's the generally accepted what happened. Then, once the air superiority was taken back, United States ships moved into the coastline, and they had water superiority. Automod doesn't like air. No, it didn't like the word destroying the Germans. I gotta go. Fuck me, dude. What do I need? My clothes. I need... Anyways, okay, let's put a pin in it. Let's pause this because I gotta go. I was supposed to go at 2:30. But great talk. You got a couple of history things twisted. It's okay. I understand. You like the United States. Big macho man. United States has to deal with all these problems. Well, boo-hoo. We'll come back 11 p.m. You can hop on Discord. We can talk about this, okay? Nope, that's not true either. It's partially true, but that's not the sole reason. A fleet, I think it was, I'll be generous. I'm pretty sure it was a U.S. Bomber crew that went and bombed Germany. Probably not correct. I'm assuming it would be the Royal Air Force. But let's be charitable and say the U.S. did that. But that allowed the Royal Air Force to build themselves back up because Hitler got hit. Hitler got pissed and started bombing London. Look up Patton as order to wait. No, EST. 11 p.m. EST. Central Time, that would be... I think that's like 10. Read some Trotsky, lad. Trotsky got fucked. Trotsky got murdered. So I'm not sure how much I can read into that. Anyways, I'm gonna go to physics class now. I'm gonna learn some physics and then also do some PLCs. And then I'll be back. And then I'm gonna work out. I'll be back at like 11. Well, I'll be back at 10, but I will take a shower and I'll probably be ready to go around 11 p.m. EST. 11 p.m. EST. Looks like that's 10 p.m. CST. Be there. Join my Discord so we can actually talk about this voice to voice instead of me reading text. But if you want to do text, fine. It's just a little bit more annoying, and I will most likely just end up saying fuck it after I have to read 6 million things. But it doesn't matter. Be here. I'll talk. All right, I love you, okay?